Again, we'll start at exactly 9 a.m. Thank you. Good morning, everyone. Welcome to the second day of the seventh Environmental and Occupational Health Forum. Again, I am Assistant Professor Abby Duarte, and on behalf of the Department of Environmental and Occupational Health of the College of Public Health, University of the Philippines, Manila, we would like to express appreciation to you all for joining us once again for day two of the Environmental and Occupational Health Forum with the theme Resilient Futures, Enhancing Health and Safety in Communities and Workplaces Amid Climate Challenges. I hope all of you are feeling refreshed and ready for another exciting day of engaging discussions as we continue exploring critical environmental and occupational health topics. Today promises even more opportunities to learn, to share, and collaborate. So let's keep the momentum going and make the most of this valuable time together. We'd also like to ask your help to get the word out. Everyone is encouraged to post a selfie while attending this forum. Please use the hashtags hashtag 7th EOH forum and hashtag climate resilient future as shown on the screen. We value your feedback, and at the end of this morning, we will be sending out evaluation forms. I would also like to take this opportunity to kindly request everyone to use the Zoom chat box to share your questions or any insights related to the 7th EOH forum. Your contributions are important in enriching our forum and in fostering a collaborative exchange of ideas. So please don't hesitate to share your thoughts about a session or a topic, even if it's ongoing. Thank you for your active participation in advance. Also, if you are dedicated to advancing public health, occupational, and environmental health, do explore our specialized graduate programs. First is the Master of Science in Public Health, which equips students with critical skills to address environmental health challenges, from pollution control to climate resilience. Through an interdisciplinary curriculum, the students gain expertise in areas such as toxicology, epidemiology, and environmental risk assessment, preparing them for impactful roles in research, policy, and practice. Meanwhile, our Master of Occupational Health provides hands-on training to improve workplace health and safety, covering essential topics like industrial hygiene, occupational toxicology, and health program development. Graduates of this program are prepared for leadership roles such as safety managers, health specialists, and policy advisors in diverse industries. UPCPH DEOH also offers postgraduate courses regularly. First is the certification course for water refilling stations and plant operators, and our postgraduate course on occupational health and safety. If you are interested in these UPCPH DEOH programs and postgraduate courses, or even the other academic programs of the college, please visit the links shown on screen. So you'll see the links at the bottom of the screen. These will be accessed through the EOH Forum Google site. Thank you, Prof. Marian, for sharing the link. Now, to kick off day two of our event, it is my pleasure to introduce Dr. Paul Michael R. Hernandez, the Director of the UP Manila Health University Office and Associate Professor of the Department of Environmental and Occupational Health, College of Public Health UP Manila, who will be providing us with a recapitulation of yesterday's discussions. Dr. Hernandez, expert synthesis of the key takeaways from our sessions yesterday, will help set the stage for today's topics and ensure that we build on the valuable insights we gained yesterday. We look forward to hearing his reflections and diving deeper into the essential themes we've explored together. Please join me in welcoming Dr. Paul Michael R. Hernandez.
Thank you, Prof. Abby. I do hope you can hear me clearly. So allow me to share my screen. I'm just waiting for my slide deck to load. Francis, can you share your screen, please, for my recapitulation?
Yes, to PM, sharing the
Thank you.
screen.
Doc PM, may we confirm that you are still online?
Yes. Can you hear me?
Okay. Thank you,
Thank
sir.
you.
We can hear you po, although your video turned dark. We lost your video, but we can hear you. Thank you, Doc PM.
Thank you. Francis, is the slide deck ready?
Hello, the PM. The first slide showing the day one activities are already shown in the Zoom meeting room po. Thank you po.
Thank you, Francis. Right. So yesterday, we've had a number of activities. The first one was on the opening lectures. We have had discussions on climate change and its impact on communities and workplaces, engaging the community in climate health initiatives, policies and plans for fostering healthy communities and workplaces in the Philippines. We proceeded with the panel discussion titled Building Climate Resilient Communities, Strategies and Innovations for Enhancing Adaptation, Sustainability, and Health in the Face of Climate Challenges. We've had 3 case studies. The first one was on Del Carmen, Surigao del Norte, another on Cagayan de Oro City, Misamis Oriental, and then lastly, Baguio City in Benguet. Next slide, please. So focusing on climate change and health, climate change remains the biggest health threat facing humanity. It is mainly caused by anthropogenic activities, particularly carbon emissions, has caused weather extremes such as stronger typhoons and drier and longer droughts. It has greatly affected vulnerable populations, particularly at-risk workers, the young, and the elderly. And it has generally impeded equitable response of health systems. The COP29 special report highlights that health is the argument for climate action. Next slide, please. One of the frameworks that I've used for this recapitulation is the socio-ecological model. We start at the individual level, the interpersonal level, institutional, community, and policy. Next slide, please.
Okay, we seem to be having some challenges with the internet connection of Doc PM. Doc PM, may we confirm that you're able to return online? All right, I think Doc PM is still reconnecting, so please allow us some time to reach out to Doc PM and offer any assistance he may need for the recapitulation. Meanwhile, we're noting your comments and questions in the chat box, specifically about the links for the courses. So while we are waiting, feel free to explore the EOH Forum Google site where you will see the program yesterday and also the links to the CPH, DOH courses and postgraduate courses and short courses. Thank you, everyone. Let's wait for a while. Doc PM, may we confirm that you have reconnected successfully?
Hi, good morning. Can you still hear me?
Yes, sir, we can hear you
All right.
and we can see you.
So
Would you
I'm
like
using
to?
another device. Apologies for that.
No worries, sir. Would you like to pick up from where you left off earlier? Francis,
Yes, please.
please share the screen on, or the next one after climate change. Yes, there you go. Doc PM, whenever you're ready, sir. Thank you.
Thank you, Prof. Abby, Professor Duarte, and apologies for the technical problems. So focusing on the individual level, we need to address individual responsibilities, particularly addressing health and its social determinants by coming up with people-centered solutions. The next, at the interpersonal level, there's a need to support intimate social relationships that would include friends, family, and social networks to reduce shared vulnerabilities. Next, on the institutional level, so there's a need to establish climate resilient institutions, sustainable urban design, energy and transport systems. At the community level, there should be, next, science-based governance, intersectoral collaborations, programs addressing social determinants. We also need to establish Dream H plans and Dream H systems. And lastly, in terms of policy, there should be international, national, and local health and climate policies, which both consider co-benefits, health equity, and even gender and development. Next slide, please. Focusing on the WHO operational framework for building climate resilient health systems. Next slide, please. There's a need to use the systems thinking approach in terms of leadership and governance. One of our resource persons emphasized that we need to make health at the personal rather than a political aspect or lens. There should be legislative collective actions by involving all sectors. So this should include LGUs, communities, NGOs, and academic institutions. We need to develop health champions and even leaders across community sectors. And lastly, there should be declarations among LGUs and communities towards decarbonization and zero carbon emission. Next slide, please. In terms of the health workers, there were recommendations on establishing health emergency response teams and building capacity of health personnel in terms of climate resilience and climate change adaptation to health. For vulnerability capacity and adaptation assessment, it was emphasized to come up with community-based assessments. This should focus on localized needs for the communities. One of our resource persons yesterday also emphasized the need to come up with disease surveillance activities, both active and passive. Next slide, please. For integrated risk monitoring and early warning, one of our resource persons emphasized the need to install early warning devices and timely relaying of warnings and preemptive evacuation advisories during natural disasters, particularly for typhoons and floods. Next slide, please. On health and climate research, we should have a health information system for database management and analysis, better reporting, and generating cost-effective interventions for the communities. One of our resource persons shared that they intend to use a digital twin of the community to detect hazards. So these would allow particular or specific needs to be addressed. And in terms of expanding the community, one of our resource persons also mentioned the use of the growth node development framework. On climate resilient and sustainable technologies and infrastructure, there should be circular economy that must be promoted among LGUs. We should have green solutions, green innovations. These would include green building designs and green energy sources. You also need to have AI to improve analysis of local health system. In terms of infrastructure, there should be super health centers and automated weather stations. And in terms of logistics, we need to make health emergency commodities and storage available 24/7. In terms of environmental determinants of health, we need to improve access to food and hunger management, employment, business opportunities, and education, particularly for vulnerable communities. We should promote health through proper education and nutrition. And in terms of social risk protection, we should have programs to address such challenges in communities. Next slide, please. For climate-informed health programs, one of the main, of the programs that has been repeatedly mentioned yesterday was on mental health and psychosocial support. And we need to respond to diseases impacted by climate change. There were discussions on anti-dengue advocacies in one of the communities featured yesterday. Another resource person emphasized the need to prepare the next generation. So we need to engage the youth in coming up with responsive and resilient health programs. In terms of emergency preparedness and management, we should have a Dream Age plan, regularly updated, approved, and very importantly, tested and disseminated. We should also have an active health emergency operations center to respond to such challenges or events. On climate and health financing, which is the last element, we should have budget based on community assessments. So for example, one of the featured case studies was budgeting for health and gender and development, and adoption of climate and health interventions policies in annual planning and budgeting processes. Next slide, please. So using the WHO operational framework for building climate resilient health systems, it's very important that we reflect on the building blocks of the health systems, and we should never forget why we're doing this. Almost all of the speakers yesterday emphasized that we need to ensure and promote health equity for everyone, ensuring that the vulnerable particularly are best, the vulnerable communities are best served by such health and health programs, particularly on climate resilience and climate adaptation. I do hope I was able to summarize the proceedings yesterday, and we're all very excited to learn about the succeeding discussions for this morning. Maraming salamat po, and back to you, Prof. Duarte.
Thank you very much, Dr. Hernandez, for sharing a great recap. We are now more ready to listen to today's exciting topics. And truly, we are privileged today to have corporate representatives from Shell Filipinas Corporation, alongside a consultant from various sectors such as service, information technology, manufacturing, and industrial facilities. They will provide valuable insights into how the private sector develops strategies to enhance workplace climate resilience. Allow me to turn the floor over to Assistant Professor Mark Emmanuel Hubo, a faculty member of the Department of Environmental and Occupational Health at the UP College of Public Health, as he will be moderating this session. Sir Mac?
Thank you, Professor Duarte. Our first panelist for today is Dr. Renato G. Joseph. Dr. Joseph is a DOLE accredited occupational health and safety practitioner and consultant with extensive experience across various sectors including IT, manufacturing, industrial, and academic institutions. Having retired after a distinguished career, he brings practical insights from small, medium, and large-scale domestic and international operations. Dr. Joseph has held roles as human resources development and served as an academician, including 20 years with Motorola Philippines, Saudi Electricity Company, and UP Manila College of Public Health. He advocates for the essential role of human capital development in effective OHS and environmental programs. Today, he will speak on the pivotal role of OHS in the development of a climate resilient workplace, sharing his insights on enhancing health and safety in communities and workplaces amid climate challenges. Please join me in welcoming Dr. Renato G. Joseph. Over to you, Dr. Joseph.
Good morning, everyone. It's an honor for me to have been invited by the Department of Environmental and Occupational Health to lecture on the pivotal role of occupational health and safety toward establishing a climate resilient workplace. I have 5 learning objectives, general at that. One is to define climate change, discuss the conventional concepts of occupational health and safety in the workplace, explain the role of OHS in addressing the climate change on the working population, and I will be citing general strategic approaches and some specifics. And then we will end up by recommending some specific measures down the line. To support the learning objectives, I have prepared a flow of presentation. It would be easy for me now that we have done with day 1, and we will be proceeding much more time and discussing the overview of occupational health and safety and its conventional concept and addressing the impact on a highly relevant OHS scenario here. Then I will be recommending some strategic approaches and some specifics, and we will be ending with major key takeaways. All right. Some disclosures with regard to my presentation, and I have some revisions that I did last night, having viewed the presentation yesterday on its day 1. So I'll be sending this to the EOH with the file name OHS Climate Change Presentation RGJ Final Updated version. So my introduction will be digging on the causes of climate change. No need to elaborate on this. We have this yesterday on day 1. And also we have discussed about what scientists have agreed that in fact climate change is happening. It's not a dream. It's really happening, and it is man-made. With its greenhouse gas emissions continue, the warning will accelerate and will put our lives and livelihood in danger. So that because of the increase in global temperature increasing in the whole world, we are put into danger because of the projection of the experts in the field. Now, the climate change, as discussed by an American society or an association, says that if anyone doesn't think this is a severe problem, they are fooling themselves. Yes, indeed. And as a recap of what is happening, primarily, it's because of the melting of the ice caps in the north area. And I have prepared some, I just have it manually so that everybody would appreciate this. On top of the melting of the ice caps, what is rather alarming is the melting of the permafrost, which also releases gases into the atmosphere. So this is quite frightening here. And that gives us a vicious cycle of the climate change. Now, this is a series of slides here that I prepared. Okay, so you have see the dotted lines there where the ice caps are fast melting. And here is the summary of all these slides that I prepared. So obviously from the 1980s, which had started monitoring the melting of the ice caps, now we are now in the danger zone, in fact. And this is the one that causes much flooding all over the world. Okay, now the next would be talking about temperature increases all over the country from the early years of when the climate change have started. So historically, there is a agency which was able to manage to record the changes in temperature from 1880 and go on and so on. So you see the yellow arrow there points to the Philippines, our country, quite alarming. Okay, there you are. Now we are on the orange and we are really in the danger zone. So the summary again from year 1884 to 2016, which is the latest, we could see that the whole world is experiencing a tremendous climate change. Okay, in terms of carbon dioxide emissions versus vulnerability to climate change by nation, we can see that the Philippines is there in the red zone of the left side of our slide. The blue circles represent, on the other hand, countries that are most vulnerable due to carbon dioxide emission. So the preceding slides will tell us that, in fact, there is a alarming cause for us to act on it. Otherwise, we will put ourselves into a much danger zone when the day comes. So we know that climate change results in heat waves, floods, tropical storms, and hurricanes. Last week was an experience for that, especially in the north area of the Philippines. And the research have shown that 3.6 billion people are highly susceptible to climate change, resulting in all sorts of health conditions, undernutrition, malaria, diarrhea, heat stress, and so many more. The direct damage caused to health is so huge. And not only that, there would be other health determining sectors expenses, such as agriculture and water and sanitation, which indirectly affects health of the nation, of each nation. Here it's emphasizing here that the Philippines, being a developing country with all the criteria stated here being satisfied, we have to be prepared indeed. And because of this, we can see that the Philippines is between the 1 to 2% increase of population. That's why the reason why I'm showing this, because later on we will be emphasizing on which programs on the company level would be my recommendations. So 1.5 degrees versus 2 degrees increase in the global warming temperature would spell a lot of difference here. And now we are in the 1.5. Most of these countries are having this experience. So in as much as we are to focus on this 20-minute lecture of mine on the health of people, All right. So here in the Philippines, just like this April, it has been reported, we have experienced this indeed, that there was a record-breaking temperatures with heat indices reaching 53 degrees centigrade. And on the 28th of that month, that heat wave caused hundreds of schools to close and at least 34 people became ill, including 6 who died. And this started early last year in May, where the Pacific has been in El Nino phase, which releases additional heat and exacerbates global warming. So obviously, we can see here the vicious cycle of this climate change that is happening worldwide. The good thing is there is hope because peoples all over the world, including the leaders of its country, are at its their own feet to say at least that they are very cautious in tackling all these issues. So I'm referring to the soon to happen IPCC conference, which will happen in November 2024, and that will be followed up by series of meetings by the different group leaders or leaders of the country. So this is kind of good news, and I'm happy that it is manifested in yesterday's program of the 7th EOH that at least in the academic level we are also putting hands on this one. So we can now discuss the occupational health and safety hazards resulting from the elements of climate change, as my preceding discussion had stated. Generally, WHO and other international health agencies have agreed that the elements that are rather alarming and as far as the workplace is concerned are the following: increasing temperatures, extreme weather conditions, vector-borne diseases, and ultraviolet radiation. I have noticed that 2 of our resource speakers yesterday have discussed this, and I'm so glad that we are starting at the right mood at that. And I would really be very comfortable in saying that and confident at that we are in the right direction. So to emphasize later, the auto workers really suffer a lot of heat stress problems in the area where they're working. And not only that, the workplace hazards are aggravated. The other workplace hazards are aggravated by the heat stress. On top of that, we have to also to mention the biological risks that are resulting from the changes in the climate. And cancer is now having in the list now, although we as Filipinos being brown raised are quite okay with this because of our natural protection of the melanin of their skin. Now, the dangerous working conditions are starting to be becoming more severe. And from my experience from small scale, medium scale, and large scale companies, we are in the workers indeed are having these working conditions. What in fact posed as a challenge is the situation that we have in the country where our economy is still in the struggling mode. So that in this scenario, all the more that we or the companies need our help here as occupational health and safety professionals. Now, for the indoor workers, what is quite a burden to them would be the high indoor temperatures. We know for a fact that Philippines has the call centers, the business process outsourcing companies in the top list of number of employed people. So we are just equally concerned with them. The other thing is because of the increase in temperature, we have to provide our workers with the personal protective equipment. Sad to say, on top of protecting, aside from protecting the workers from the hazards of the workplace due to the wearing of the personal protective equipment, there had been observation that in fact this also poses them quite a discomfort while they are working. So this is quite ironical to state this, but this is really happening nowadays. Now, for all of this, the impact factors become a vicious cycle in the working environment. So we know for a fact that because of the human body is dynamic and we have some physiological coping mechanisms, just the same, workers would suffer some health impact because of the climate change, both outdoor and indoor. So at the right side of our presentation, I stated there a series of things that can viciously occur as the climate change is happening. What alarms me as an occupational health professional is the fact that people are suffering from what they term as eco-anxiety and other similar psychological disturbance in the workplace. Of course, this is multifactorial. I have observed and have initially concluded that what really initiated this was the pandemic that had happened 2-3 years ago because of the COVID-19. So that I would like to emphasize again, time and again, that there is a vicious cycle. Therefore, we have to break that vicious cycle. And with this invitation to talk and discuss the programs in the workplace, I'm so glad that we are really on the right path. We have to break, in the company level, we have a pivotal role and a major role at that to address the issue. So this is the discussion proper, the OH's role in addressing the impact of climate change on the working population. So before I go into that, let me just walk you through on the overview of the company's occupational health and safety in its conventional concept. Okay. So the World Health Organization, since several decades ago, have formalized the definition of occupational health as an area of work in public health to promote and maintain the highest degree. This is very challenging. Highest degree of physical, mental, social well-being of workers in all occupations. So to support this definition, WHO came up with these objectives. And I feel that most of these OHS practitioners, and to specifically point out, of course, our programs there at UP College of Public Health, which is the Masters of Occupational Health, is really keen on this in emphasizing to our students the need to include this in the programs of the company. Now, the only thing is, personally, I believe that this can only be achieved. What I refer here is to the highest degree, can only be achieved simultaneously with the climate resilient workplace programs. Okay, so we must put this in mind, colleagues. Now, to give you an idea, I just enumerated a number of relevant tools that we are using in the company level. One is the hazard identification and risk assessment and control, which is the HIRAC. We have to factor in the changing climatic conditions, not only to be contented with what's in there in the workplace, but let us always consider the environmental conditions that affect not only the working conditions, but primarily the health of the worker. Hierarchy of controls, we also must consider personal attributes of the worker to include the medical condition of the worker. We know that when we have 4 categories, wherever we assess the health of the worker as A, B, C, D, where we can still employ category A and category B to the workforce. And then the various learning tools, I highlighted the need for us to validate the information because of the Facebook and other social media issues where anybody just can post anything online. And we are there to guide our constituents on reading and taking this information to consideration. Now, one thing that I would like to emphasize, let us put our hands on, we OHS professionals, to the various HR health-related policies. We have to have a very active participation in program planning for us to be visible in terms of the implementation of these different occupational health programs and services. The checklist monitoring and evaluation on file, let us put our act together to ensure that the monitoring and evaluation becomes a vital HR health services program for the integration of a climate resilient workplace program. So how do we address the impact? Okay, so we have to have a robust health and safety organization, I prepared each slide for a small scale, medium scale, and large scale companies. What I'm just emphasizing here are those in brown and underscored words and phrases here and clauses for you to have focused on. Just take note of this from the file from the DOH that they will be providing you. And because of time considerations, we do not have the time really to spend its detail. So just to remind everybody, OHS personnel as per DOLE, we have health practitioner and health consultant. And just go through it. It requires some theoretical theoretical and training from the different institutions. So from small and medium scale enterprises, we can transition from a purely workplace standards to include environmental impact assessment tool as an occupational health and safety practitioner or consultant. So we have to collaborate also with our LGUs as emphasized by our speakers yesterday. So we have to embed, if your company is a large-scale enterprise, make sure that the system is embedded in the workplace already. It becomes a routine task requirement for everyone. So we have to focus on human capital and collaborate again with government and private agencies as far as programs addressing climate resilient workplaces. Okay. So being a leader in a company, we have to be visionary. We have to start with the hiring of personnel and recruitment processes in terms of gap that we could identify in terms of their skills or their competencies in climate resilient matters. We have to provide them continuous training at that. So organization, we have to have them included in the policies and procedures. And I suggest that this OHS, including the climate resilient workplace criteria, should be included in the individual employees' goal plan and in their development plan as well. So recommended approaches and strategies here, we have to skip this because in the interest of time. So corporate risk managers think of sustainability mechanisms and strategies, and I'm so confident that by the next resource speaker would elaborate on this. Okay, some sample policies that I have included here based on my experience. This is a small company that I'm into here now. It's Walls in Motion. It's a environmental management policy that I formulated last July. And this will go a long way, and I would progress in still revising as we go along the developments as far as climate change is concerned. So it's a complete elements of everything here. Okay. Now on heat stress prevention plan, we have to emphasize because heat stress is the #1 thing that is being experienced by workers. The vital elements would include training, drinking water should always be available, shaded area should be provided, well ventilated, acclimatization, 20% percent of the work has to be given to the worker who is new in the outdoor environment, 20% per day to make it 100% in 5 days. And then drinking water, I have mentioned that already, 1 cup every 20 to 30 minutes for people who are working. So I have provided, this is a policy that I formulated in a big company in Saudi Arabia, which has been well implemented. Now, for the general policies, because we have the threat of the different infectious diseases due to climate change, we have to have infection prevention and control to consider climatic factors, risk and vulnerabilities, emergency disaster preparedness plan. As the mainstay, health and wellness and well-being, please do include the dimensions of wellness, not only the physical health, but just please include also psychosocial health, mental health in the workplace program. And the training communication, make sure that there is the appropriate behavioral change that is observed in the workplace. So I have here some slides, the before and after 3 months ago, which I made as a baseline. And 3 months, I'm so glad that the work environment in the small scale company is progressing. So the key takeaways, climate change is a long-term change in global and regional climate patterns. Although the effects are multifactorial, we have to be alerted on this because we know that the impacts will undergo a vicious cycle unless we act on them. Its effects influence weather patterns that result in less predictability. The damage caused of climate change are significant and will increase over time. International bodies and agencies manifest cooperation among each other to mitigate the humongous effect of climate change. And the occupational health and safety in corporations can contribute in playing a pivotal role in establishing climate resilient workplaces. Significant trend and greater efforts is taking place with the support of the business and the workforce, the organization in general, and the community and the leaders of the respective governments and countries as well. So workplace programs have to take a considerable shift from a conventional concept to one that is integrated with the function of the agency with the full integration of the climate resilient workplace concept. We have to have an active role in HR health programs from conceptualization to implementation, including monitoring and evaluation. So these are my references, and that ends my presentation. Thank you, gentlemen and ladies. Good morning.
Thank you, Dr. Joseph. Our next panelist for this discussion is Dr. Rosalie B. Rivera. Dr. Rivera currently serves as the Country Health Manager for Shell Filipinas Corporation. She holds a Doctor of Medicine from De La Salle Medical and Health Sciences Institute and a Master of Occupational Health from the University of the Philippines, Manila. She has participated in various relevant seminars over the past 5 years, including training in psychological first aid and health systems operations. Recognized for her contributions to employee well-being, she has received numerous awards, including the Asia Employee Well-Being Award in 2021 and the Gold Anvil Award for her Be Well for a Healthier Shell initiative. In her presentation, Dr. Rivera will share valuable insights on how Shell Filipinas has implemented sustainable practices that support a climate resilient workforce. Her expertise will provide a unique perspective on fostering workplace resilience while safeguarding the health of employees and the community. Everyone, please join me in welcoming Dr. Rosalie V. Rivera. Over to you, Doc.
Thank you, Professor Mark, for the introduction. And thank you to UP for inviting me in this very, very important topic on climate resilience. I will now share my screen. Kindly check that I am not muted. Thank you. Okay. Can you see my screen?
Yes, Doc, we can see it, Doc.
All
Thank
right.
you.
Okay, thank you. Good day, everyone. I am really pleased to share with you the journey of Shell companies as well as our employees in developing climate resilient workplaces and employees. So, to start, this is the purpose of Shell globally, where we just do not focus on generating shareholder value, but we look at three very important factors where climate change is impacted. The second one is on powering lives, where we power lives of not just our employees, our customers, but the communities where we operate, where our products and our activities support our inclusive society. Another purpose is on achieving net zero emissions, where we work with customers and all our external stakeholders to accelerate the energy transition to net zero emissions. And lastly, but very importantly, is respecting our nature, where we protect the environment, reduce our waste, and making a positive contribution to biodiversity. And we do this together with underpinned by our core values and our focus on safety and health. In the Philippines, we strongly support this global commitment through these progress pillars, and we really are targeting to achieve this in by 2050 or even sooner. So the pictures that you see on the right show some of the examples where we are slowly but surely transforming our operations into cleaner energy solutions and also providing the same to our customers. So in the next the next slide, actually a video, I would like to share just a 2-minute video of what our company is doing. So I hope you enjoy this and learn.
Shell's history tells a story of commitment, of resolve, and action. For over a century, Shell has been growing in the Philippines and changing people's lives. This history has guided us to today. We carry the torch now to build a better tomorrow, to power progress. Today, our team of over 5,000 employees remain committed to empower Filipinos. That is why all across the Philippines, our energy presence is felt to power lives and businesses. We want you to thrive, to enable Filipinos to be agile. We are paving the way for better journeys through efficient supply of quality products and services to meet all mobility needs, whether by land, by air, or by sea. We are enabling unparalleled mobility for all Filipinos to empower you like never before. We need to shape the future to enable next generations to thrive. And in this complex world, Shell continues to take strides to create a future built upon innovative and sustainable solutions. With low carbon products and a growing number of charging terminals seamlessly integrated into everyday use. And as we develop our businesses in the Philippines, we continue to develop solutions to remain at the edge of knowledge for a cleaner future. Shell's past has energized us to look forward, and together with Filipinos, our actions will drive a progressive future. So join us on this journey to build a better tomorrow. Join us to power progress for the Philippines.
Okay, so that was our president, our country chairman, speaking about our initiatives and the solutions that we do in this journey of protecting our planet Earth. Now, indeed, climate change is very real and it is inevitable. And last year, we actually experienced about 42 to 51 degrees heat stress index, and that has really affected our operations. So I would like to share with you. And by the way, we also had, of course, the floods, right, brought about by the rains and the typhoons. So it has really becoming, the wet is becoming wetter and the dry is becoming drier. So in our operations, I'd like to share with you, during heavy rains and floods and typhoons, the flexible work arrangement has really worked very well for our employees, so we can choose to stay home and continue to be productive and to continue to be safe. And we also have our business continuity management to make sure that the critical operations continue to serve the Filipinos. We have a timely monitoring and alert for our employees, the SNS as we call it, so we can monitor the whereabouts of our employees and how safe we are, and also receive alerts regarding emergencies. We continuously provide advisories and leptospirosis and provide the prophylaxis for those who are affected by floods. For the worker welfare program that we currently have for our contractors, we provide safe transport, food provisions, on-site hygiene and sleeping quarters for those who will not be able to go home, and keep them safe in our facilities. After the floods, we immediately do rescue and relief assistance and also participate in the recovery and rehabilitation through partnerships with our external stakeholders. Now, the heat is another matter. So during heat intensive periods, and we expect that to happen again, we have enhanced our heat stress management program and is still continuously doing so. We have shifted our risk assessment from on the sources of heat stress to really strongly consider ambient and outdoor work and not just the equipments or the confined space. This is something that we are moving into where our standards for action level from WBGT now into the more available and immediately available heat stress index. For the work rest regimens, we have found out that it has become very disruptive if we strictly follow the work rest regimen that is we are currently adapting. So we have shifted to heat stress protective work scheduling where we could start work as early as 5 a.m. when the sun is still, not still very hot, have that long rest period from 10 to 2 and then resume afterwards rather than having short breaks intermittently. We have revised some of our long sleeve coveralls to more comfortable, making sure that it is still safe for our workers, and reviewing the use of our respirators, which are aggravating the heat stress that our employees our workers are experiencing. We have enhanced our hydration with electrolyte replacements and also our cooling facilities, providing misting and additional ventilation for them. For the care for our workers, we just don't rely on body system anymore. We have reinforced the supervision because the Filipino culture is that we just continue to work, right? And even if we are not feeling well anymore, so we really have to have that closer supervision and highlighting the care for self and our overall well-being. Currently, we are updating our safety protocols and also deciding on our stop work protocols and how we will resume. So we are planned to implement this in 2025, bearing in mind the overall goal of achieving a LARP to ensure balance of our business targets and care for our people. So that's for our operations. Now, I'd like to share with you what we do for our employees because we would like to personalize that we can provide our own solutions in the climate change journey. So we have provided an integrated approach of well-being together with HR on health and on sustainability. So we have a flexible spend allowance that enables our employees to use renewable energy in our homes, solar panels, for example, as well as our well-being. We have an eco-friendly workspace now where there are no plastics and so we use reusable eating utensils and cups. We allow our employees to take home the used coffee grounds from our coffee machines as fertilizers, and we do food composting already, and this food composting results to production of eco bricks that are used for the construction of school facilities that we support and even our retail stations. And you can see here other examples in the slides. So I just like to also highlight that in our health initiatives, we've been doing the stairwell to be well for decades already. But now we highlight that we actually save electricity as well if we do not use the lifts or the elevators. We partner with our foundation that provides plants, fruits, and vegetables, and we offer that to our employees. And we have already included vegetable dishes in every meal that is offered to our employees. And we have learned from our employees hydroponics and are growing lettuce in our cafeteria and give it for free to the employees. Now, speaking of food, we have jump started on sustainable eating starting last year, and this is our nutrition month that we usually celebrate every July. We have focused on food security, how people how can we reduce our footprint. Yeah. Footprint is the environmental impact of the food that we eat from farm to our plates. And what we found out is that the healthier that we eat, it also makes our planet healthier. And if we could just measure that through this footprint calculator, then we are able to have a more visible risk assessment of the practices that we do. Lastly, just like to share with you that this program has actually earned the company recognition from none other than our president and our board of directors. And I'm just really happy for my team who have really made this program possible to all our employees. Thank you very much.
We'd like to extend our warmest gratitude to our speakers, and their expertise has greatly enriched today's discussions and will guide our efforts in addressing the key health challenges at the intersection of the environment and the workplace. At this juncture, we will now open the floor for questions and discussions, and I'd like to invite Drs. Joseph and Rivera to come back on screen, please. Okay, while I'm checking our questions, and I'm seeing a lot of insightful questions from our participants. Our forum will proceed with Dr. Joseph speaking first, followed by Dr. Rivera. Okay. For our first question, many organizations lack occupational health and safety systems in their workplaces. What initial actions should these organizations undertake to integrate climate resilience into developing their OHS systems? Okay, go ahead po. Again, let me repeat the question. The question would be, what initial actions should these organizations undertake to integrate climate resilience into developing their OHS systems? For those organizations who lack occupational health and safety systems in their workplaces.
Well, I can start based on our experience. Thank you, Professor Mark. So for us, it really starts with at the top, because as employees, as individuals, climate change can be complex, right? And it's hard to be able to personalize it, and the company needs to be a model for all of us. So, and we started in our company, as an example, we started our internal review of the operations that we do, the products that we provide to our customers, and really focused on how can we reduce the impact of our operations and our products to climate change. And that's why we have those purposes that I have shared. That's not enough. Then we bring it to the employees, right? Because we have to live that purpose as well, and simplify that through simple practices on how we can make a difference even in small matters in the activities that we do.
Thank you, Dr. Rivera. Dr. Joseph, may we hear your insights, please?
Yes. For me, the needs assessment should take precedent on all these things. In as far as we have to consider how big or small the company is. We know that for small companies, they can just afford the basic requirements. So that brings into the discussion that the management should focus on the minimum requirements that the law provides in terms of occupational health and safety, at the same time while developing the competencies of the OHS professional. So time and again during my discussion, I have emphasized the major role of OHS personnel that could have a persuasive and convincing authority towards the management decision. because we know that HR are having that they take the role of sad to say some of them take the role as OHS as well, which is kind of heartbreaking for us professionals. So that we have to be assertive in this regard. One thing that we have to prove is as a starting OHS professional, we just have to make sure that the right attitude and behavior are manifested so that the management could fully support us on our cause on occupational health and safety, and later on climate resilient programs in the workplace. So, as a general statement, business are here to earn profits, and we have to convince them not only to earn profits, and in fact, we have to capitalize or invest things for our workers, because a healthy workforce means productivity and efficiency in as far as business success is concerned.
Thank you, Dr. Joseph. For our next question, I'm sure that we have a lot of OHS professionals in our participants. So the question is, how can OHS professionals be trained to integrate climate resilience into their practices? Let me repeat the question. How can OHS professionals be trained to integrate climate resilience into their practices? Okay, Dr. Joseph, maybe you can share some insights about it, please.
I've been into organizational development as part of our HR programs here in many of my years of experiences in small scale companies, including big ones like Motorola Philippines. So I've been in charge in hiring. So to answer that question, I have to start with the hiring and recruitment processes. If I'm hiring an OHS team member, I make sure that the competencies are satisfied as far as the company is concerned, again, vis-a-vis the requirements of the company. So we have to assess again the needs of the company and to match the competencies of the applicant in the position. So the response to your question, Dr. Mark, is comprehensive, and I think it would take a 2-hour session in DOH seminar or whatever to expand on this.
Thank you, Dr. Joseph. Dr. Rivera, please.
Yeah, I agree with Dr. Joseph. No, for us here in Shell, we it's a learning journey. Yeah, you cannot learn this in one sitting or in one training, because the issues on climate change are also evolving, and the science and the things that we can do are also evolving. I mean, the nutrition program that we did, we just learned about that recently, that oh, we can actually do that, right? And the eco bricks and the new technology on food composting are all coming up, and that's why we continuously need to be partnering with the experts, because we are not the experts, but I guess as OSH practitioners, it is in our DNA that we include sustainability and climate change in our programs. Yeah. So maybe in the postgraduate course, when I do my lecture, I will include already climate change in the next batch.
Okay. Thank you, Dr. Joseph and Dr. Rivera. So in the interest of time, this concludes the Q&A session, and we will bring your other questions offline after the forum. So we're going to collect and send the questions to you, Dr. Joseph and Dr. Rivera. We again extend our heartfelt thanks to our esteemed speakers for sharing their invaluable expertise with us. As a token of our gratitude, we are honored to present each Dr. Joseph and Dr. Rivera with a certificate of appreciation. Please allow me to read the citation. The College of Public Health, University of the Philippines, Manila, CMEO Tropnet, Philippines, Regional Center for Public Health, Hospital Administration, Environmental, and Occupational Health awards the Certificate of Appreciation to Dr. Renato G. Joseph and Dr. Rosalie D. Rivera for their invaluable contribution by sharing their expertise as resource person during the 7th Environmental and Occupational Health Forum with the talk entitled The Pivotal Role of OHS in the Development of a Climate Resilient Workplace and Developing Climate Resilient Workplaces, Implementing Strategies and Best Practices for Enhancing Adaptation, Safety, and Sustainability in Response to Climate Change, conducted by the Department of Environmental and Occupational Health, done remotely from the College of Public Health, University of the Philippines, Manila, on 22nd November 2024. Given this 22nd day of November in the year 2024 in the city of Manila, Philippines, signed by former Dean Romeo R. Quezon, the overall chair of the 7th EOH Forum, Dr. Crystal Emil M. Estrada, the Department Chair of the Department of Environmental and Occupational Health, Dr. Sharon Yvette Villanueva, Associate Dean for Research, and Dean Fernando B. Garcia, Jr., the Dean and Center Director of the College of Public Health. Thank you again, Dr. Joseph N. Rivera. I now return the virtual floor to Professor Abby Duarte. This has been your moderator, Professor Hugo.
Thank you very much, Sir Mac, and thank you also to Dr. Rivera and Dr. Joseph. Now, as we prepare for the rest of the sessions for today's forum, we'd like to take a brief wellness break to recharge. So please take this opportunity to stand, to stretch, hydrate, and relax, and be sure to return promptly for the next session as we continue with our program. So it's 10:11 a.m. Let's have only a 10-minute break. So we'll see you again at 10:21 a.m. See you at 21 a.m. everyone. Thank you. Hi, everyone. I'd like to welcome you all back from the break, and I hope that you are ready to resume. We'd like to acknowledge again everyone present at the forum. And at this point, please allow me to request a little participation from our attendees. May I request you to type in the chat box and share where you are right now, what city or what town or what country you are in right now. Yan, we'd like to know where our participants are situated, no, as you are tuned in to the 7th EOH forum. So allow me some time to read the chat of our participants. So there are participants from Zamboanga, from Makati City, from Cebu, from Muntinlupa. There are also participants coming from Laguna, from BGC, from Pampanga, from Metro Manila, Quezon City, Pasay. There are also participants coming in from Davao City and from Puerto Princesa City of Palawan. There are also some colleagues coming from Misamis Oriental, from Davao del Norte, Dumaguete, and even from Ilocos Norte. Rizal, Bataan, Zambales, Pampanga, Antipolo, Pasig, Baguio City is also represented in this forum, and even some are coming from Cabanatuan, from Iloilo, General Trias, Cagayan de Oro, Negros Occidental, and we also have a participant listening from the Gulf of Mexico, USA. We hope that the time difference is bearable. I'm not familiar though with the time difference. We also have participants coming from Ifugao, from Pakil, from Bulacan, from Tagbilaran City, Bohol, and many other places. I'd like to mention there's also one tuning in from Qatar. Okay, so it's nice to know that we are joined by Filipinos all over the Philippines, and there are also participants coming from the USA and even from the Middle East. So we truly appreciate your participation, no? Despite the distance, we are all here to attend the 7th EOH Forum. So thank you again to everyone. Now, for those wondering about your attendance at this forum and how it will be recorded, your answer to the activity evaluation will be counted as your attendance. So please visit our EOH Forum Google site using the link provided in the chat box. So Prof. Marian will be sharing it shortly. But this link will also be emailed to all registrants shortly after the event. And the submission of forms will be accepted until 3 p.m. today. Now, as we near the final session of our two-day forum, we shift our focus to innovations for climate resilience across various settings, and that includes workplaces and communities. This upcoming panel discussion will explore strategies to foster resilience in the face of climate change, emphasizing the importance of maintaining safe and sustainable environments. By harnessing technological innovations and nature-based solutions, we can strengthen the health and safety of diverse environments, ensuring communities and workplaces are better equipped to face climate-related challenges. Allow me now to turn over the floor to Associate Professor Marian Lomboy Capino, a faculty member of the Department of Environmental and Occupational Health at the UP College of Public Health, who will be moderating this session. Prof. Marian, over to you.
Thank you so much, Professor Duarte. So we will now start our panel 3 discussion. And our first speaker in this panel is Ms. Dana Laida Babela. Ms. Babela is an air quality management and climate change mitigation practitioner with a master's degree in chemistry from the University of the Philippines in Diliman. She currently serves as a senior researcher at Clean Air Asia, where she leads key initiatives focused on sustainability and air quality. Ms. Babela is dedicated to advancing capacity building efforts and engaging stakeholders to promote effective air quality strategies across Asia. Her previous experience includes research roles at the Natural Sciences Research Institute and a teaching position at the Institute of Chemistry. Passionate about inclusivity, Ms. Babela actively participates in outreach programs, fostering a greater understanding of science among students and educators. In her presentation, Ms. Babela will share key strategies for enhancing hospital resilience through effective air quality monitoring, including using innovative technologies to track air pollutants. She will also discuss the importance of creating healthier, more sustainable hospital environments where patients and healthcare workers can thrive while mitigating the risks of poor air quality. Ladies and gentlemen, please join me in welcoming Ms. Dana Laida Babela. Over to you po, Ms. Babela.
So, thank you for that introduction, Prof. Marian. So let me just share my screen. Checking. Checking po if okay na po.
Yes, Ms. Dana, we can see your slide.
Thank you. So, I'll start first with introducing our organization, Cleaner Asia. So Cleaner Asia is an international non-governmental organization that leads the mission for better air quality and healthier, more livable cities in Asia. So we have offices in Beijing, China, New Delhi, India, Jakarta, Indonesia, and our headquarters is here in Metro Manila in the Philippines. So the UN also recognizes our organization, and our partnership network is comprised of more than 250 organizations all around the world, including country partners in the region. So just to quickly share what we do at Cleaner Asia, we focus on giving science-based policy guidance and empowering stakeholders towards actions at the city and national and regional levels, all towards climate change mitigation and and managing air pollution. So our approach basically can be summarized in this diagrams. So we ensure that we establish a knowledge base, which we delve into what is the level of pollution, what are the sources of pollution, and what are its impacts. And we use these knowledge base or information to develop solutions that are sound, data-driven, evidence-based, and develop solutions which could be institutionalized through integrated climate change and cleaner action plans at the city or national level. And to give everyone an idea of air quality management, the diagram on your right shows the different areas or components of air quality management, which can include air quality monitoring, emissions inventory development, or basically a listing of what are the sources of emissions in a certain geographic scope. This could also include modeling. And then we also have health and other impacts. And then we also have air quality communication, developing of cleaner action plans, and governance and financing solutions. And the overall goal of air quality management is to protect human health and welfare. Before I move on to the next slide, if you would like to learn more about air quality management and Cleaner Asia support, I've placed here a link to our learning portal, which you could include. I could also send this later after my talk. By the chat. So I've been talking about more on air pollution and air quality management. So how is it linked with climate change? So the co-benefits of air pollution and climate change mitigation is that air pollutants and climate pollutants, which includes greenhouse gases and short-lived climate pollutants, basically come from similar sources. So if we address one, we also address the other. So to give us more on what is the motivation to address air pollution and mitigate climate change, the 2024 State of Global Air Report puts air pollution as the second highest global risk factor for death, or ranked fourth also in the 2020 report. So you could see like from 2020 it was ranked fourth, and then in 2024 it's now the second. And based on the 2024 report, 8 million total deaths were due to air pollution, where majority of these deaths, around 58%, are attributable to ambient PM or particulate matter 2.5, while the rest are attributable to household air pollution and ozone. And children are part of our vulnerable population. In 2021, 709,000 deaths of children under 5 were linked to air pollution, and this accounts for 15% of all global deaths. In our local context in the Philippines, air pollution ranked second for the risk factors that drive the most death and disability combined. So this only shows how we should also give importance in addressing air pollution and climate change together. So we know the impacts of air pollution and climate change, and it is imperative that we act to address and mitigate them. As a step to air quality management and climate change mitigation, we need to measure to know our baselines, what are or basically what is the current air quality level or air pollution level, so we know what we are trying to address, how we will address them. So we need to measure to know our baselines, to set targets and plan for interventions or actions to address these issues. So in terms of measuring air pollutant levels, we do air quality monitoring. And we have several technologies available. So I've shown here like as a very summary. So we have reference instruments, which are the most accurate equipment for quantifying air pollutants. And however, these are very big. They require more resources, space, power, supply, and highly technical personnel for its operation and maintenance. So this is the photo here is an example of a reference station of EMB. I think this is the one in Manila City, in Mahan Garden. So reference instruments are what we call the gold standard in terms of air quality monitoring. So they are very accurate. We also have what we call non-reference instruments. These are more popular within the last decade due to its availability and rapid technological innovations. They also have features that aims to address concerns, especially on cost, because reference stations are very costly. They cost millions, and non-reference stations are cost less, and they are more accessible and portable. And they also have an increased data access to the public with a caveat on data accuracy. Similar to another type of non-reference instruments, or at least one that I think is also that became more popular within the last few years, especially due to the pandemic, are personal or portable devices. So to characterize these are devices that are compact, lightweight, to this designed to measure air quality exposure in real time for individual use or specific occasions. Okay, so in the next slide, in air quality monitoring, just like any other scientific processes, our data needs to be accurate. So this can be done with collocating or calibrating the non-reference sensors or instruments with a reference instrument to apply correction factors, because non-reference instrument may demonstrate bias or shift, which can have an effect on the data accuracy. So in terms of so we need to calibrate or collocate to apply correction factors to improve the accuracy of our data that we get from non-reference instruments. So in terms of understanding air quality data, we need to understand the complete story by collecting what we call ancillary data or other supplementary data that can help us understand or explain the information that we've obtained from our sensors. So this can include like activities within the vicinity of the sensor. So for example, if a certain city where the sensor is located, there are parades or fireworks that are being set off, we usually log that, or in case of fire events, we also we also collect that to check how those activities can affect our air quality data. So maybe we can have like a short, also very quick activity with everyone in the room. So so here I have a question, like how many hours do you spend indoors in a day? So how many hours in a day do you spend indoors? So just a quick survey. So I think most would be saying 6 hours, 8 hours some. So basically, we spend most of our day indoors. And we know more. I think it's more common to hear about air pollution mostly in the ambient setting, but we also need to be studying and be aware of what are the impacts of indoor air pollution as we stay more often indoors. Okay, so We've discussed impacts of air pollution, and here in this slide are impacts of um, air pollution and climate change specifically in hospital settings. So this can include impacts on vulnerable patients and can affect patient outcomes, increase the risk of hospital-acquired infection, and can also affect even our healthcare workers. And the table below shows an excerpt from the World Health Organization guidance on climate resilience and environmentally sustainable healthcare facilities. And I'd like to highlight the risk for increased premature mortality related to air pollution. So ultimately, what the messaging that I'd like is how we could, how air pollution and climate change are interlinked, and how and what are their effects to indoor settings, especially in our hospitals. So to help address impacts of air pollution and climate change in hospital settings, we can apply air quality monitoring to gain insights on pollution exposure of patients and vulnerable population. So air quality monitoring sensors can be placed in the facade of the hospital to measure what is the air pollution levels outside the hospital and also indoors. So when placing our sensors, there are some guidelines that we have to follow, such as they are away from immediate sources, for example, like putting it away from the exhaust of air condition or so on. And then in terms of monitoring indoor air pollution in hospitals, it might be a question like, where do the pollutants come from? So many healthcare facilities can contribute to ambient air pollution through on-site fossil fuel energy combustion or medical waste incineration. Other activities can also include purchase of energy generated from fossil fuels, um, or even using facility vehicle fleets as well as patient and staff transport system can also contribute to air pollution emitted from transportation. Okay, so for this slide, I'd like to highlight how indoor air quality monitoring has a role in enhancing climate resilience of hospitals. So basically, the gist is that through indoor air quality monitoring, we understand the levels of indoor pollutants. And with these, we can plan for interventions and implement them in response to pollution episodes and minimize the harmful effects of pollutants. So the timely response to um, episodes or high levels of pollutants could be applied, which also contributes to the preparedness of the hospital management. Okay. So once we are able to monitor, we can now compare our data to air quality guidelines. So to quickly define what are air quality guidelines. So air quality guidelines or standards prescribe the acceptable level of air quality adopted by a regulatory authority as enforceable. So some air quality guidelines that are available are the WHO air quality guidelines, which are recommendations of limit values for specific air pollutants to help countries achieve air quality that protects the public health. We also have in our country national ambient air quality guideline values, which are limits on criteria air pollutant concentrations recommended by DNR intended for the protection of public health, safety, and general welfare. So to note that these values are for ambient air quality or outdoor air quality. We also have some specific guidelines for indoor air quality on selected pollutants. And in other countries, we have, for example, in the United States, in the Green Building Council, they use the American Society of Heating, Refrigerating, and Air Conditioning Engineer Standard guidelines on indoor air quality procedure, which applies an annual mean of 9 microgram per cubic meter for PM 2.5, while California Air Resource Board is the one who has indoor air contaminant concentration values for PM 2.5. So just to move through our discussion, we know now what is the role of air quality monitoring, how it can help hospitals in their climate resiliency, and even addressing air pollution or in outdoor and indoor air pollution. Now here I'll be sharing what are some of the key elements in designing air quality monitoring strategy for hospitals. So number one, we can identify critical areas for monitoring. So this can include patient wards, operating rooms, ICUs, or high traffic zones, or even HVAC system intakes and exhaust points. We also define what are key pollutants to monitor because this will also inform us to the technology that we need to procure. So we can identify PM 2.5, carbon dioxide, VOCs, or other key pollutants. And next would be, as I've mentioned earlier, selecting the appropriate monitoring technology. So we have various air quality monitoring sensors. If there are even portable sensors. So based on what pollutants we want to measure and where, we can identify what are the which appropriate technology could we use. So for example, real-time sensors for continuous data collection or portable monitors for spot checking and validation. Next, we also establish baseline indoor air quality levels. So we need to understand what is our starting point so that we know if our actions are successful in doing in achieving our objectives in improving indoor air quality. So we can use the baseline data to set thresholds or targets, which I'll share a bit more later. And then implement regular monitoring and data analysis so we could scheduling routine checks and ensuring the continuous system operation. And of course, analyzing trends to identify what are the seasonal or operational variations that we can look into further to inform what strategies we can do to address indoor air pollution. So next, setting thresholds, actions, and alert systems. So we can define at what threshold do we need to trigger alerts and actions in response to the levels of air pollution that we are experiencing. And we can integrate this with building management system for automated responses. And then just last two, so we need to engage stakeholders and train staff on what are the interventions that we can do. So we empower our staff, even our patients, on what they can do to change their behaviors in terms of improving air quality within the hospital setting. And lastly, we can integrate monitoring with resilience plans, such as aligning indoor air quality data with emergency preparedness and climate change mitigation strategies. Okay. So for my next few slides in my last few minutes, I'd like to share a case study on indoor air quality monitoring in a maternity hospital, or specifically the Dr. Jose Fabella Memorial Hospital at their old building, which we conducted under the 3M Asia Blue Skies program. So under the program, actually, we developed Manila City's Cleaner Action Plan, which outlines the strategies that the city can take to address local air quality and climate change issues. As part of implementing the action plan, we look into studying interventions and practices that we can apply in a hospital setting where vulnerable groups are frequently found. And we conducted, in our study, we deployed two non-reference instruments, one in the public ward and one outside by the waiting area. So to share as well that prior the deployment of these non-reference sensors, we co-located them with DNREMB's reference instrument at Mehan Garden from August 2020 to May 2022, which is actually the longest field collocation or calibration experiment in our country. And through this, we were able to apply correction factors which ensured the accuracy of the sensors, of the data of the sensors. So as the setting is at a maternity hospital, I'd like to highlight some effects on pregnant women and newborns, which include the exposure to PM 2.5 and ultrafine particles during pregnancy can create a window of vulnerability for fetal development and long-term health effects of children. So in another study, it was also found that pre-eclampsia, I hope I mentioned that correctly, and pregnancy-induced hypertension are 50% more likely to occur in women exposed to 5 microgram per cubic meter increments of ambient particulate matter, 2.5. And newborn or infants exposed to PM can develop several respiratory and neuropsychological health effects. So the objectives, so this just further highlights why we need to monitor or apply indoor air quality monitoring and be more conscious of what the air quality values are within our hospital and healthcare settings. So the objectives of our study was to understand the influence of outdoor air pollution to indoor air quality, to inform actions to reduce air pollution in the city and reduce public exposure risk. And we were able to develop a technical write-up or manuscript which has been submitted for publication and a policy brief on achievable measures to improve indoor air quality in healthcare settings. So we did this with the Cleaner Air Project team shown here, and also with a research collaborator, Dr. Colleen Rosales Brock. So I only have a few slides left, so I hope if you could give me like a bit, maybe 2 more minutes. Thank you. So just to quickly share, these are photos of our sites, and just to emphasize that the public ward, its features are, it include the most important feature maybe I'd like to highlight is that the windows of the public ward is never closed, so air is continuously going in and out. And overlay, moving on to the results, we can see here that overlay of indoor and outdoor PM 2.5 levels shows similar trends and patterns. So this gives us an idea that outdoor air pollution influences indoor air pollution, especially that the public wards windows were always open and never closed. Looking further into other trends, we see that PM 2.5 levels are highest during Wednesdays and Saturdays. And in terms of diurnal trends or throughout the day trends, we see peaks at around 6 a.m. and 7 p.m. for both indoor and outdoor PM 2.5, and another extra peak at 12 noon. So to understand the trends, we consulted with the hospital management to understand what activities could explain the data. So for the 6 a.m. and 7 p.m. trends, we attributed this to traffic activity, as this is also in line with other data that we have from other sites in the Manila City Air Quality Monitoring Network, which shows that roadsides have the highest PM 2.5 levels and green spaces have the lowest. And it also corroborates that our emissions inventory results that shows that 95% of emissions in Manila City come from the transport sector or from vehicles. So for the indoor air trend, the additional peak at 12 noon, based on our consultation, we've deduced some potential activities that may cause the resuspension of PM 2.5, which can attribute or account for the additional peak. So this can include foot traffic caused by the movement of patients, the changing of the beddings, cleaning and sanitation of the ward using cleaning materials such as bleach, detergent, and wax, collection and movement of garbage, and the trolley delivery of meals during lunchtime. Okay. So to analyze the data, we can also compare them to the air quality index. So the AQI is a categorized system for reporting air quality of air in relation to human health. So in this slide, we're comparing the data to D and R's PM 2.5 AQI breakpoints. And the message we'd like to relay is that without monitoring, we wouldn't know if air quality levels are already unhealthy levels. And it is with monitoring that we know when we should apply actions or interventions to protect public health, especially in the hospital setting. So this would be my last 2 slides. So just sharing that under the program, we were able to recommend what are some interventions that the a hospital setting can do to address or improve their indoor air quality. So there are actions that can be done within the hospital. So for example, on ventilation and exhaust, closing the windows at specific times where peaks of PM 2.5 or pollution levels outdoor are higher, to prevent pollution or pollutants coming inside. We can also optimize the heating, ventilation, air conditioning system or HVAC system by regular inspection and maintenance. We can apply filtration systems such as use of filters, and also air filtration system on our air conditioning systems, and also use of chemical materials and cleaning materials that do not contribute to forming more pollutants, so non-PM farming cleaning materials, chemical-free floor scrubbing technologies, and vacuums equipped with HEPA filter, use of UV cleaning technologies with specific wavelength. So this is to avoid catalyzing the reactions of atmospheric species that can contribute to secondary pollutants. And use of air cleaning devices that does not put out radicals, ozone, or ions, because these can also contribute to formation of more pollutants. Outside, we can look at how we can regulate traffic, as traffic is one of the major contributors to air pollution in the city and even in the vicinity of the hospital. Other recommendations is to consider planning the hospital layout to ensure that vulnerable patient groups are away from emission sources such as the main roads and other equipment that can contribute to indoor air pollutants, and the use, of course, of air quality monitoring systems for indoor and outdoor to monitor and overall call for action on the improvement of overall air quality in the city. So here is my last slide to just briefly summarize and share my key takeaways. So collaboration among different sectors is crucial to allow a holistic approach in maintaining healthcare environments that are resilient to air pollution and climate change impacts. And the use of data from monitoring to inform interventions and resource allocation for it must be included in policies and guidelines related to hospital healthcare, occupational safety and health, and healthcare system and healthcare workers must be equipped with knowledge and resources to track and address indoor air quality while ensuring minimal exposure of patients. In health facilities with limited resources for air conditioning or filtration, there is an even more urgent need to address both outdoor and indoor air pollution. And my last message for everyone would be that science-based policies, investment, and collaborations are important to drive actions to improve indoor air quality, especially in hospital environments, to protect patients and staff from health and impacts of air pollution and climate change. And with that, I conclude my presentation. Thank you so much for indulging me the additional minutes. I hand over back to Prof. Marian.
Thank you so much for sharing your work on hospital IAQ monitoring at Clean Air Asia, Ms. Babella. The presentation of Ms. Babella highlighted the critical role of effective indoor air quality monitoring in enhancing hospital climate resilience. And there are key insights from the presentation, such as identifying IAQ challenges and implementing strategies like real-time monitoring and adherence to air quality standards to mitigate the risks. Let's move on to the next presentation. We are pleased to welcome Ms. Joanne C. Flestado, a nature-based solutions specialist at Conservation International Philippines Foundation Incorporated and an expert in sustainable development and climate resilience. With a background in environmental management, Ms. Flestado has extensive experience integrating nature-based solutions into urban planning and climate adaptation strategies. Her work focuses on ecosystem restoration and conservation, recognizing their critical role in enhancing resilience to climate change. In her talk, Ms. Flestado will highlight how nature-based solutions contribute to long-term climate resilience. Ladies and gentlemen, please join me in welcoming Ms. Joanne C. Flestado. Over to you po, Ma'am Joanne. You're on mute, Ma'am Joanne. We're unable to hear.
Hello po, good morning po.
Yes, ma'am, good morning.
Opo, can you see my screen po?
Yes po, it's visible, ma'am.
Ah. So good day, everyone. So it's an honor to be here with you today as we explore an essential and timely topic, innovations in climate-smart health practices, nature-based solutions for climate resilience, leveraging nature and technology to enhance healthcare facility resilience. Moving. Ayun yung next. Lang po, sorry. Ayun yung mag-next.
Joanne, there's an arrow on the lower left of your screen. Yun po yung next, for your next slide. It's beside one of
Okay.
5.
Okay.
Yes, ma'am.
Ayan. So,
Thank you
the
po.
objectives for today are to explore how hospitals can remain functional and resilient amid climate change challenges, and to highlight nature-based solutions and technological innovations as critical strategies. So why it matters? Climate change increases the frequency and intensity of extreme weather events like typhoons, floods, and heat waves. So poor indoor air quality exacerbates respiratory conditions and the spread of airborne diseases during such events. Health facilities must mitigate their climate impact while adapting to environmental changes. So what are the key challenges or the impact on health facilities of the climate change? So these are the key challenges. First, extreme weather events. Second, indoor air quality, resource strain, and increased health risks. So for extreme weather events, typhoons, hurricanes, floods, and heat waves are becoming more frequent and intense due to climate change. And these events cause direct damage to healthcare infrastructure, disrupt supply chains, and impede access to facilities. So the impacts on hospitals are infrastructure damage, operational disruption. One of the case example is during the Hurricane Sandy in 2012, where hospitals in New York faced significant infrastructure damage, resulting in over 1 billion in costs for some facilities, prolonged closures, and emergency evacuations of patients. For indoor quality, rising temperatures and increased humidity levels promote the growth of mold and other indoor air pollutants. Poor air circulation worsens respiratory conditions and increases the risk of airborne disease transmission. The impacts on hospitals are exacerbation of health conditions and increased disease transmission. So, heat waves lead to poor ventilation, worsening asthma, chronic obstructive pulmonary disease, and other respiratory illnesses. And patients recovering from surgeries are particularly vulnerable to infections caused by poor air quality. Increased disease transmission. So high humidity can enhance the survival of pathogens, increasing airborne disease risks, and hospitals lacking proper air filtration systems become hotspots for hospital-acquired infections. Climate change disrupts access to vital resources like water and energy, which are essential for hospital operations. Many facilities face increased demand for these resources during emergencies, while supplies become less reliable. So again, the impacts on hospitals are water shortages and energy outages. So example solution, some hospitals in low resource settings are implementing solar energy systems as backup power to ensure continued service. Again, increased health risks. Climate change contributes to the spread of climate-sensitive diseases such as heat stroke, vector-borne illnesses, and waterborne diseases. It also intensifies pre-existing conditions like cardiovascular and respiratory diseases. So the impacts on hospitals are rising patient loads. So heat waves lead to spikes in heat stroke, dehydration, and cardiovascular emergencies, and outbreaks of diseases such as cholera, dengue, and malaria overwhelm healthcare capacity. The impact on hospital is long-term strain on health services, persistent health impacts such as stunting from undernutrition due to climate-induced food shortages, increased chronic disease management demands. So warmer temperatures and disrupted precipitation patterns have led to cholera outbreaks in flood-affected areas, forcing hospitals to divert resources for epidemic control. Okay, so now we will discuss what is nature-based solutions or NBS. These are basically strategies that use natural processes to solve environmental, societal, and health challenges. So what are the examples of NBS solution or nature-based solutions in health facilities? So these are green infrastructure like rooftop gardens, biophilic designs that integrate natural elements into healthcare facilities, incorporate a passive ventilation system to reduce energy use, and treat wastewater on-site with eco-friendly methods. Basically, what are the benefits of nature-based solutions? These are improved indoor air quality, enhanced thermal comfort and energy efficiency, increased resilience to extreme weather, and of course, improve patient care by creating healthier and more comfortable spaces. So these are examples of technological innovations in nature-based solutions. First, the green walls and roofs. So its functions filters pollutants, improves air quality, and regulates building temperature. Examples are vertical gardens in urban hospitals to reduce heat. Yeah, so yun yung example niya. Next, passive ventilation systems. Combines plant-based designs with engineering to promote airflow and reduce energy use. Example are courtyards and open atriums with vegetation. So, ang example na to galing sa Hill County Courtyard in Greensboro, Alabama. Next, rainwater harvesting systems collects rainwater for hospital use during droughts. Example are integrated with bioswales for natural filtration. So, ganito example niya. So, ano yung bioswale? Bioswale is a ditch that allows for rainwater to soak into the earth slowly rather than flooding streets or going into the ocean. So for our case studies, we have Singapore's Kutek Wat Hospital, Rwanda's Butaro Hospital, and India's All India Institute of Medical Sciences. In Singapore's Kutek Wat Hospital, over 50% of the campus covered with vegetation, and this hospital achieved 30% energy savings and reduced urban heat island effect. In Rwanda, the Butaro Hospital uses natural ventilation and local materials designed to reduce airborne disease transmission in resource-limited settings, and in India, implemented rooftop solar panels and rain gardens, and it provides sustainable cooling during heat waves. Okay, so ganito po yung itsura ng hospital din sa Singapore, yung Kutek Hua Hospital. Ito naman po yung sa Rwanda, Butaro Hospital. And this po in India. Okay, so what are the best practices for implementation? So we can learn from this case studies. So again, we have tools like the World Health Organization Hospital Safety Index that will help identify vulnerabilities and prioritize action. So una natin gawin is conduct risk assessments. Number 2, cross-sector collaboration. So it is partnership with urban planners, environmental scientists, and architects. Next, community engagement. As involving local stakeholders ensures the solutions meet the unique needs of the community. Next is capacity building. So we will train healthcare workers and administrators in using and maintaining these systems. And again, regular conduct of monitoring and evaluation to ensure the success of the project. So again, what are the benefits of climate smart hospitals? The health benefits are to improve the air quality. It reduces respiratory issues and disease transmission. For the environmental benefit, it lowers our green gas emissions and enhance biodiversity. For economic benefit, energy savings and reduced operational costs. And for resilience benefits, enhanced capacity to withstand and recover from climate-related disruptions. Next, the challenges and solutions. So the challenges are first, there is a high upfront costs for infrastructure improvements. Next, limited expertise and resources in many healthcare settings. And lastly, third, resistance to changes in traditional hospital design. So our solutions are first to leverage climate finance mechanisms such as green bonds and grants. Number two, showcase successful NBS applications to build confidence and commitment. And third, incremental implementation starting with scalable pilot projects. Okay, so here are our call to action. So advocate for policy integration, promote policies encouraging the adoption of NBS in healthcare facilities. Second, to invest in research and partnerships, to collaborate with academia, governments, and international organizations for innovative solutions. And lastly, to start with small, high-impact projects such as rooftop gardens or renewable energy systems. That's all. Thank you.
Thank you so much for your presentation, Ms. Flestado. So the presentation of Ms. Flestado emphasized the importance of nature-based solutions in enhancing healthcare facility resilience against climate change. The key strategies mentioned included integrating green infrastructure such as rain gardens, biophilic designs to improve environmental sustainability, reduction of energy use, and creating healthier spaces for patients and staff. Maraming salamat po, Ma'am Joanne. Okay, so we now move on to our final speaker for the third panel discussion. And our speaker is Dr. Alfredo Mahar Francisco A. Lagmay. Dr. Lagmay is an esteemed academician of the National Academy of Science and Technology and a professor at the University of the Philippines National Institute of Geological Sciences. He leads the University of the Philippines Nationwide Operational Assessment of Hazards, or UP-NOAA, and the UP Resilience Institute with a focus on volcano tectonics, disaster forensics, and climate change adaptation. Dr. Lagmay holds a PhD in Earth Sciences from the University of Cambridge and has been recognized with numerous awards, including the Presidential Citation for his search and rescue efforts in disaster scenarios. He is also a prolific researcher with over 100 peer-reviewed articles and has received several international awards, including the Plinius Medal from the European Geosciences Union and the START Network Change Maker Award. So in his presentation today, Dr. Lagmay will discuss innovative science and technology solutions that can support climate resilience efforts across various sectors. Ladies and gentlemen, please join me in welcoming Dr. Alfredo Mahar Francisco Lagmay. Over to you po, Dr. Lagmay.
Hello, can you hear me?
Yes po, Doc.
Okay, sige. Meron pa yatang hotdog sa ngipin ko. But anyway, let me share my screen. Okay. Start broadcast. kita na po.
Yes po, Dr. Lagmay.
Paano ba to i-play? Yan. Siguro yan. Okay. Dala. Okay, I'll be talking about harnessing science and technology for climate resilience communities. This is the title that was provided to me, Innovations in Early Warning Systems. So magkikwento na lang po ako about people-centered early warning systems. Ito po yung kasi yung kailangan natin, no? And kasi ang ating concept of early warning is that ito yung binibigay ng pag-asa. No? Ito yung binibigay ng NDRRMC na kapag meron parating na bagyo or habagat, sinasabi natin na ay pakinggan yung abiso, mag-iingat sa landslides and baha, no? And floods. But actually, a real early warning system is people-centered. It involves many things, and just a part of it involves yung ating common concept of early warning, no? Which is given by for storms, pag-asa, and then for mga volcanoes and earthquakes, ito yung PHIVOLCS. People-centered early warning system involves many other things, like the development of risk knowledge, which is systematically collecting data and undertaking risk assessment. Yung monitoring and warning service, ito yung traditional concept natin. And then yung dissemination and communication, we relay or we get that message across the risk information and early warnings. And then also we have the response capability, which is basically all of us. No? Kailangan natin ma-educate, kailangan natin magkaroon ng culture of resilience para pagka merong warning, we respond appropriately. And because all of these things mukhang hindi in place, at least from the perspective of the international community, we are number one in the risk index. When we talk about risk, we're not just talking about the hazard, yung baha or whatever, and then meron din exposure, who are exposed and who are vulnerable. So meron yan, yung how sensitive the community is to a hazard impact, like for example, construction materials, how many people there are below the poverty line, how many ang matatanda, no, etc. So it's a very complex formula to determine risk. But they have determined na ang Philippines is number one, apart from the hazards, the risk, no? Kasi yung ating vulnerabilities, yung ating capacity, yung ating sensitivity to the impacts, they think that it's quite low. All right. So when we talk about hazards, we are really talking about mga mga hindi yung bagyo mismo, o hindi yung strong winds that can topple trees, yung floods, like yung strong winds yung nangyari sa Catanduanes because of Pepito. Floods, everybody's familiar with that, yung mga rain-triggered landslides, storm surges, and of course, yung kabaliktaran naman, pag walang ulan, yung drought, no? Among many other things. These are what we call as the hydrometeorological hazards. There are also geological hazards. The earthquake per se does not kill. It's the hazards that kill. So, ang mga hazards, yung ground rupture, pag nagtayo kayo ng bahay sa taas ng fault, nag-rupture yon, mabibiyak yung bahay nyo. Pag shaking, naman, yung hazard, kailangan alam natin yon if gaano kalakas yung ground shaking in case magkaroon ng malaking earthquake like the big one that's expected in Metro Manila, magnitude 7.2. According to the building code ba, yung inyong bahay o yung inyong ospital or yung whatever. No? And there are many other hazards na related to geology. For volcanic hazards, it is also considered as a geological hazard, and there are many hazards again. Each and every item here, there are corresponding maps that we need to look at to whether there's that particular hazard present in your neighborhood. No? Pwedeng school ni Junior, o kaya yung bahay ninyo, o kaya yung office ni Mrs., no? Office ni Mr. So kailangan yung tinitignan yon dahil pag dumating yung impact na yon, you don't want to look at the map when the catastrophe is happening. We need to do that now. And there are maps that are available to find out all of these hazards. And all of these natural hazards can get aggravated by climate change. No? Actually, basically yung mga ang tawag nito, mga hydrometeorological hazards ang ma-affect. Kasi yung climate change related karamihan yan sa atmosphere. No? So merong mga typhoons, may mga monsoons that get aggravated. Like ang sabi ng mga climate change scientists ay yung mga bagyo lalakas, mas madaming ulan, and thereby dadami yung mga landslides, rain-triggered landslides, lalaki yung mga baha. And we have shared concerns na dapat pag-aralan natin, and we should know what to do as early as now. Shared concerns yung dating disaster risk reduction na tinatawag, and how we respond, we build resilience in communities to adapt to the changing climate na merong mga consequent adverse impacts. Hence, the term, I'm sure you normally encounter this, it's called CCA-DRR because of the shared concerns, climate change adaptation and disaster risk reduction. Okay, so I'll talk now about the risk, the hazard impacts. Kasi yung the COVID-19 affected practically all of this in this list, di ba? Lahat ng sectors, agriculture, coastal, water, health, ganun din yung mga natural hazards. When they impact, especially if it's widespread, covers a large area, malaki yung disaster, it can also affect all of these sectors in this community, including health, including tourism, including education, the energy sector, the environment, settlement, etc. So we need to do something about this. Kasi this is part of the risk knowledge, no people-centered early warning system. And I heard yung parts of the previous talk, and she was actually talking about these things, no, how to prepare. In fact, the health sector, merong malaking ibang health sector. Kasama ka, Christine PH sa Naga City. Kakaawa din sila, no? Parang they did not expect such kind of rain to happen. 700 plus millimeters of rain delivered in 24 hours. For comparison, ang Ondoy was 455 millimeters per hour delivered within 24 hours, mostly within 6 hours. Pinapakita ko sa kanya na, ang mga hazards, risk, hindi lang pang evacuation center ang mga involvement natin dyan, ang ating pag-aaral, ang ating pagpaplano. It also affects the public health sector. No? So in fact, meron nga yung anak niya na I didn't realize na mapapakita ko pala sa kanya ito. No? So si Jill co-authored a paper on disaster medicine and public health preparedness. And the title was Public Health Impacts of Disasters from a Philippine Perspective. Now, isa-isahin natin, no, yung sectors ng people-centered early warning system. Sa risk knowledge, systematically collect data and undertake risk assessments. Ano ba yan? Bigay tayo ng example. So, doon sa Agoncillo, Taal, because of Christine, ganyan ang nangyari. And the people didn't know what it was. So, kailangan may scientists na mag-i-explain what it was, diba? What it is. What the hell? Why do you have all of those logs, bamboo, debris all over? No? So, bakit merong mga bato doon sa ilalim, malalaking bato na sprawled all over, and it damaged everything. No? So, kulang tayo ng risk knowledge kasi hindi natin na-expect itong mga ganitong pangyayari. And kailangan ma-develop pa natin yung science, yung research about this, where these hazards can impact, ano yung distribution ng mga impacts na ito, where it is highest, no? Ano ba yung gravity na pwedeng mangyari? There's science available to do all of this, no? And somebody needs to explain why this happened, bakit merong mga gravel and sand, etc. Now, once we understand all of those, we need to put them into maps, no? So what you're looking at is Laurel, one of the coastal towns of Taal, and this was taken probably 2 weeks after the floods of Christine. And you see satellite image, and pagka gumamit tayo ng science, we can actually predict where those deposits and then floods will happen. So kailangan hazard specific, no? Sa area, detailed barangay level yung mga maps, so that we can prepare for events like what happened during Christine. And ang tawag dito mga hazard maps, no? Basically, it's there to tell you whether there's a hazard in your house, no? What kind of hazard to expect when there's a storm incoming that's coming in. And what's good about this map is that apart from the hazards, it tells you where the safest places are. So habang may warning ang pag-asa na masama ang panahon, you go first to, if you find that it's in the blue, you go to a place where there's no color, where there's no hazard. Temporarily, no? Not permanently. So you can avoid death. If meron tayong mga maps na, okay, this is again the satellite image na ganito, it's widely available, and lahat naka-color. So it's hard to see where to go. So the business of hazards mapping really is to tell us where the hazards are, and also tell us at the same time where the safest places for evacuation should be, and where the places for future development should be, such that when you have hazard maps like this, you can plan accordingly, appropriately. You can develop in a resilient way para kahit dumating yung hazard, ito yung mga blue and violet and green, pag dumating yung hazard, development and people are out of harm's way. Wala tayong disaster na pag-uusapan. Remember that yung Agoncillo, yung Laurel, meron silang nagkaroon ng eruption noong 2020. Nagkaroon ng eruption noong 2020, lahat ng mga kakapal na ash napunta dun sa Agoncillo, napunta dun sa Tagaytay, Taalisay. And I think we're still feeling the effects of that, no? When it rained heavily, extreme rains that were dumped there. So bago ko pakita yon, pakita ko muna na apart from the January 12 eruption, sunod-sunod pa yung eruptions which dumped a lot of ash doon sa west side ng coastal towns of Taal Lake. And then, because of that, nung umulan ng malakas nung Christine, kahit akala natin sa roads wala na, mukhang na-remobilize lahat ng ash na yon, and it developed into what we call as lahars. So mukhang lahars, karamihan yung tumupok doon sa coastal towns ng Talisay, Laurel, and Agoncillo. And if you go there, nakakaawa talaga sila kasi nakalubog sa buhangin tsaka mga bato yung kanilang mga bahay. And it's not just one house, it's not just two houses. We're talking about hundreds to thousands of houses which were damaged. Now, apart from that, the problem is not finished. Meron pang bug. So, kailangan ng monitoring pa nun, di ba? Kailangan alam natin saan papunta yung bug, etc. because this may be related to respiratory illnesses. That brings us to monitoring. So kung wala tayong values ng amount ng bug, ano ba sa tingin ng PGH, ng UP Manila, ang dangerous levels, no, dapat we should take appropriate actions. But without the data, paano yan? So that's why we need monitoring. No? So monitoring is about development of hazard sensors that monitor all sorts of parameters like rainfall, water level, and early warnings that will be the basis for early warning services. So this is a kind of early warning service. This one is from JTWC. US Navy Joint Typhoon Warning Center, yung sabihin. So merong track, tiningnan kung saan dadaan yung ano. That is monitoring, a type of monitoring. We have satellite images that are available. So there's technology. Before, 100 years ago, during the Spanish, ang hirap malaman ito kung nasaan yung bagyo. But now, we have all the tools. No? Pag red, dyan malakas yung ulan. Pag yellow, mas maliit doon sa red. Pag white, much less rain. Pag blue, wala kang ulan na pinag-uusapan. So these tools are available. And then, noong dumaan yung Christine PH, mataas yung I, no? Kasi yung signal number refers to wind. But the rainfall, ito yung hotdog ng DILG, because it's called the hotdog. Diyan nagpe-prepare dapat. Nakita nyo, ang laki ng hotdog. Mayroon pang mustard, yung dilaw, no? Kasama yung all the way to maabot doon sa Visayas region. No? So that's the warning based on the monitoring. And then sa UP, meron din. Sinasabi ni Jerry Bagtasa, ganito yung dami ng ulan na pwedeng bumagsak. He even warned ng Christine PH na it's going to be intense for Batangas. You can see Western Batangas being black. That means sa monitoring niya, mayroong warning tayo na advance na pwedeng umulan doon sa lugar na yon. So we have at UPRI and NOAA Center been developing an impact-based forecasting system, which won the innovation pitch sa USAID and World I think it's World Food Program. It's for anticipatory action. No? Kasi kailangan natin ng tamang action. No? Kailangan natin ng tamang monitoring. And I think it's best if we don't wait for bulletins. We are empowered ourselves. No? And if we plan well communities with the hazard maps that tell us the places that are hazardous and also the places that are safest in a community, we can do anticipatory action. And I believe that planning is the quintessential anticipatory action. So in this impact-based flood forecasting system that we developed, we can estimate flood damage, allocate resources efficiently, etc. Kailangan ng maps. These are the maps that I was talking about earlier. This is risk knowledge. So meron kang river na ganyan, people need to know that when it rains heavily, no, like for example ng Karina or Christine PH, a community can look like this. Kasi maraming yung mga communities, they settle on floodplains. They are a natural part of the river. Mahirap ang flood control dyan, especially pagka yung mga malalaking flood events that overwhelm the infrastructure, which are only designed for a rare but a high magnitude event. No? Sabihin ng rare, minsan lang nangyayari, let's say once every 100 years with a high magnitude event na napakataas na baha. So yung Karina was a 100-year rain return event. So meron kang ganyan na tapos biglang babahain. And pag hindi aware yung mga tao, hindi na monitor yan, hindi na monitor na mayroong bagyo pala, ganyan. So magkakaroon ng baha without people knowing. Pag may mga surprise, marami na surprise, it may turn into a disaster. So we have a forecast, no? That's part of the monitoring 24 hours in advance. So we can actually get that amount of rainfall that can be translated when it's overlain with the hazard impacts. Which barangays can get affected. It's both in table form, no? Kasi it's both in table form and graphical form. So the flood maps were derived from Project NOAA, which is nationwide, and the rainfall amount, the simulations are done by Dr. Jerry Bagtasa. You can follow him at Weather Manila. He's a professor of meteorology. He has a Twitter account and a Facebook account. And it would be good if people are also involved, no? So yung mga model validations through social media reports are very important. During Karina, all of the reports that came in validated the simulation. So gumaganda yung science, no? Parang mas na-affirm natin yung validity niya, yung accuracy niya. So the more that people participate, actually there were about 2.66 million who visited the site, searched for their place in one day during Karina. So that involvement engages them and is good for disaster risk reduction kasi nagiging mas participatory. And when they are engaged, it raises the stake at solving the problem, our problem about disasters. Now, the third part of the people-centered early warning system is dissemination and communication. So, communicate risk information and early warnings. Pagka imminent na yung danger, of course, media helps very much, no? Pati yung hanggang doon sa walang pasok, nandyan, meron tayong mga pagbagyong Pipito, which just recently ravaged Catanduanes. It's very important. So, hindi lang yon, even you communicating to a friend what you learned about the warning that's given by NDRMC or PAGASA, that helps. And also, communication, importante rin yan, no? So, we're trying to find ways by which to communicate better risk knowledge through mga ganitong mga ano. Ewan ko lang kung nadidinig niyo yung sound, but pagka nagiging ganyan siya, no? So, we are trying to do Muppets, mga puppets, no? Similar doon sa dati, yung sina Pong Pagong, sina Islaw Kalabaw, sina Alice Kamatis, sina Kuya Boji. And we're trying to improve the way by which we can relay information. The last part is response capability, which is build national and community response capability. Sino ba yan? Tayo lahat yan. Please disabuse yourself of the concept that it's only government that is responsible. Lahat tayo responsible kasi we need to build our capacity. Capacity individually, capacity ng family, capacity ng community, and capacity as a nation. So all of us are involved in solving the problem. So importante, I think na yung pag nag-warning, lahat tayo may response capability, may response capacity, and the higher it is, the less risk we have. So I guess the international community perceives us to be parang failing in some parts, no? And I think it's about the vulnerability part in the equation of risk. Napakita ko na to kanina, So this is the anticipatory action. It's really empowering people. I'm talking about citizen empowerment now. Importante yung mga mobile apps that the real-time data are available. Hindi lang for VOG, dapat nandun, pati itong mga weather stations that tell us nasan ba yung ulan at any given moment. So there are tools available, there's technology, there's science to give us the risk knowledge, and the monitoring systems, no, that's required in the people-centered early warning system to empower all of us. Kasi matatalino naman ng mga Pilipino, merong mobile technology, merong internet technology, and we can always calibrate ourselves through time. Yung lahat itong mga data about looking at the weather outside, kung sunny ba siya, ulan ba siya, with the sensors, we can check it out, match it with, is it a dark, cloudy day, gaano kalakas yung ulan. So if we have all of these data sets, we are empowered. When we are empowered, we act in a better manner. So flood modulation validation reports. So kailangan din natin sa communication yon. Pinakita ko na ito kanina. Know your neighborhood. We try to improve the way by which we communicate, engage people. Sometimes we use celebrities, si Ding Dong Dante, si Atom Aurelio, to engage a lot of people. Para yung people-centered early warning system, gumaganda, no? So the better it is, the more involved people are, the more empowered people are, the more engaged they are in doing planning for their communities, no? Building the response capabilities, the risk knowledge across sectors, hindi lang for floods, hindi lang for evacuation centers, helping out in the monitoring, no? Validation, reporting, and communication. All of those pillars in a people-centered early warning system, we can be engaged in. And if we are all together in this, we can actually reduce the fatalities as what had happened before. We were able to avert 15 disasters. And there's been a significant reduction in the fatalities, fatalities starting 2014. So dati ang average natin from 1986 to 2013 was about 1,000 to 1,250 deaths per year. Because we did something, we were worked together, there were policies that were implemented, laws that were enacted, like the Climate Change Act, the DRM Act, mas malawak yung education. For many years now, medyo yung hazard-specific early warning system, people-centered early warning system natin translated into the significant reduction of deaths on average per year. Ngayon, 250 deaths na lang per year on average from hydrometeorological hazards. And medyo nakakatakot kasi tumataas na naman ulit. Hopefully, we can all bring it back, that system that we implemented sometime in 2014. I guess I'll stop there. Thank you for listening. Thank you.
Thank you very much for your insightful presentation, Dr. Lagmay. So in his talk, Dr. Lagmay emphasized the importance of a people-centered early warning system, which not only ensures the timely dissemination of accurate information, but also prioritizes understanding and integrating local contexts to enhance effectiveness and community preparedness. Okay, so our panel 3 discussion has been incredibly enriching, and it offered valuable perspectives into creating climate-resilient communities and systems. Okay, so we'll now move on to the open forum. We will open the floor to questions and further discussion. I would like to invite Ms. Babela, Ms. Frestado, and Dr. Lagmay to please turn on their cameras. Okay, so we will address the first question to Ms. Babela. How can hospitals in low-resource settings overcome barriers to establishing indoor air quality monitoring programs? Ma'am Dana?
Thank you for the question po, Prof. Marian. So for hospitals with limited resources, I think number one, or actually in general po, not just hospitals, but even the cities that, some of the cities that we work at that are operating with limited resources in terms of air quality management, including air quality monitoring, what we usually identify some of the things that they could do to overcome yung barriers on this is, of course, number one, we look for partners that can help support the initiatives of the hospital or the city. Other than that, we can also look into options that are more affordable. So I've mentioned that there are non-reference instruments. These are more affordable in comparison to other reference instruments. So non-reference instruments, they can cost medyo varied po yung price points niya, but ultimately all of these non-reference instruments, they need to be calibrated, collocated. So working with various partners, NGOs, academe, it can help pool resources that is available. So this can help overcome at least the barrier on financial constraints. So medyo theme siya talaga in terms of air quality management. So another thing that we've seen that's a trend also in the work that we do with the cities is that it seems that DRR fund can be tapped to help din nga po achieve yung air quality monitoring efforts. So again, we want to integrate integrate or have synergies with air quality or air pollution and climate change. So ito po yung isa sa mga ways that we can do to overcome barriers. So tap at our available funds, have collaboration and partnerships po across various sectors.
Thank you so much, Ma'am Dana, for emphasizing the importance of collaboration in overcoming these barriers. This is just a quick question for you, ma'am. Is there available technical assistance from Clean Air Asia to develop an air quality monitoring system in hospitals?
So right now, usually we operate din po based on what our funds or projects that we have. So I guess yung short answer ko is we always look for opportunities and partnerships to help us in working in various sectors. So definitely we are yung health sector po is one of the important sectors that we have in this sphere. So ayun po. So sorry, hindi naman siya Miss Universe answer, but rest assured that we are looking at how we can design our projects to also tap sa other sectors to add input so that we could have a multi-sectoral approach, mas holistic po yung approach natin in terms of air quality and climate change mitigation, especially for our country.
Thank you po for that information, Ma'am Dana. Now, let's move on to Ms. Flestado, who focused on nature-based solutions for climate resilience. Ma'am, a participant asked, how can hospitals and healthcare systems start small, high-impact projects to build momentum for larger climate-smart initiatives?
Opo, nabanggit ko na po siya kanina sa presentation ko, pero po para po sa mas realistic po na examples, we can start small. Like kung ano po yung budget na meron tayo, we can start po yung mga small greening initiatives to keep our hospitals, 'di ba po? Ayun, may mga plants tayo doon, magtanim tayo doon. Tapos yung mga energy saving na mga activities natin, the usual that we do, we keep our mga lights off when not in use, we save water, we properly dispose our waste materials, yung mga ganun po. Parang in general po, parang it's environmental action activities po. Pero based on nature-based solutions, yun po, yung innovative po. Na binanggit ko kanina, we can add po yung paggamit ng mga solar panel, pag meron na po tayong mga mas malalaking budget. And yun po, we can leverage din po yung mga climate funds that we have. Yun, pwede po kayong mag-apply ng mga grants, ganun. Meron din po kasing mga LGU. Like nung nag-work po ako sa Batangas City before, meron pong programa yung Batangas City na Green Hospital. Parang ina-awardan po yung mga green hospitals dun po sa Batangas City. So, ganun po. I-leverage po natin yun para engage tayo sa ganung programa ng LGU, sumali tayo doon. Tapos yung mapapanalunan natin, gamitin pa natin para ma-expand natin yung... Thank you.
Thank you, Ma'am Joanne, for those practical suggestions. No? So let's now turn to Dr. Mahar Lagmay, who addressed the broader topic of science and technology for climate resilience. Dr. Lagmay, please let me read this question from one of our participants. How do you see emerging technologies such as AI and machine learning enhancing the effectiveness and timeliness of early warning systems for natural disasters? And what role do you think these innovations play in reducing overall risk and improving community resilience? Dr. Lagmay.
Well, I think that the question is all about what my talk was about, no? Except that walang gamit ng AI. So to answer that question, dagdagan na lang natin ng AI yung lahat ng sinabi ko, no. In fact, we have the UP is going to give us a budget for the impact-based forecasting system using AI. So basically, what's that all about is paggamit ng AI dun sa existing na impact-based forecasting system na pinapaganda pa namin. Siyempre, with AI, marami tayong mga pwedeng makuha mga information through time na natututo yung impact-based forecasting system based on the inputs of people and based on the data inputs that continuously come in. Sometimes mahirap natin manually na gawin yon, no? But with AI, napi-filter niya yon, nagagawa niya ng mga, I don't know, siguro mga insights and doing it, no, na mas efficiently than how we do it. In the same way that it efficiently gives students, no, ways by which they can write, no, hindi yung yung generative, no, kung hindi improve their essays, na they can give suggestions on what next to do based on what AI can recommend, no? So yun, that's what we intend to do with the impact-based forecasting system, which unfortunately up to now parang hindi pa rin masyado nagagamit, no? So kailangan pa rin ng widespread education. So we really can't rely just on AI. It can help us, but we have to guide it.
Thank you po for sharing that very important insight, no, in relation to the question. So we actually received a lot of questions po from our participants, and we invite Dr. Lagmay, Ms. Flestado, and Ms. Babela to address participants' questions in the chat box. Additionally, we will compile any remaining questions and relay them to the speakers for their review and response. So we'd like to thank all of our esteemed speakers, Dr. Lagmay, Ms. Flestado, and Ms. Babela. And we also thank our participants for the continued engagement in today's session. So this concludes our brief Q&A session, and we now move on to the awarding of certificates. So as a token of our gratitude, we are honored to present each of our speakers with a certificate of appreciation. Allow me to read the citation. The College of Public Health, University of the Philippines, Manila, Semiotroped Philippines, Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health awards the certificate of appreciation to Ms. Dana Laida Babela, Ms. Joanne Flestado, and Dr. Alfredo Mahar Francisco A. Lagmay for their invaluable contributions by sharing their expertise as resource persons during the 7th Environmental and Occupational Health Forum, conducted by the Department of Environmental and Occupational Health, done remotely from the College of Public Health, University of the Philippines, Manila, on 22 November 2024. Given this 22nd day of November in the year 2024, in the city of Manila, Philippines. Signed, former Dean and overall Chair of the 7th EOH Forum, Professor Romeo R. Quizon, Dr. Amiel M. Estrada, Chair of the Department of Environmental and Occupational Health, Dr. Sharon Yvette Angelina M. Villanueva, Associate Dean for Research, and Dr. Fernando P. Garcia Jr., Dean and Center Director. Thank you very much po to our esteemed speakers.
Thank you
Maraming salamat po.
for inviting.
Okay, so this concludes our panel discussion 3. This has been Marian Lomboy Capino, your moderator. I will now hand over the virtual floor to Professor Duarte. Over to you, Professor Duarte.
Thank you very much, Professor Lomboy Capino, for moderating that earlier session, and thank you also to all of our speakers. Now, as we approach the final session today, it is my pleasure to turn over the floor to Assistant Professor Gaylene F. Manalang Jr., a fellow faculty member of the Department of Environmental and Occupational Health, College of Public Health, UP Manila. She will be moderating the concluding lecture and guiding us through the concluding lecture of the forum. Over to you, Prof. Gaylene.
Thank you, Professor Duarte. In the complex matter that is climate change, the challenge will be to ensure all are engaged towards the desired outcome, mitigating the hazards while creating a sustainable future for all. Advocates must have a view of the depth of the concern and the breadth of solutions. We are honored to have Mr. Renato Redentor Constantino deliver today's concluding lecture on integrated and sustainable climate resilience strategies. Mr. Constantino, a renowned climate action advocate and sustainability expert, is the managing director of the Constantino Foundation and the former executive director of the Institute for Climate and Sustainable Cities. With decades of experience in climate policy, renewable energy, disaster risk reduction, and community-based adaptation, he has played a key role in shaping climate action plans and advocating for climate justice in the Philippines. In his recorded concluding lecture, Mr. Constantino will share insights on integrating climate resilience strategies into business practices, urban planning, and policy making, highlighting the importance of multi-sectoral collaboration in ensuring long-term sustainability and resilience. We advise that Mr. Constantino did not share a slide deck in this recorded lecture. Activating the closed captions feature of Zoom may assist those in the among the participants who will need visual prompts. All are still invited to share questions and remarks for Mr. Constantino. They will be collected by the organizing committee and brought to him for a response offline. Let us now proceed with the lecture, Integrating Strategies for Sustainable Climate Resilience, a Path Forward for Communities and Workplaces.
Good morning, everyone. Thank you for having me. I speak right now from Baku in Azerbaijan, where the United Nations climate negotiations is taking place. My name is Renato Redentor Constantino. I head the Constantino Foundation, which works to advance usable history through art and poetry and transdisciplinary pedagogy. I'm also the international advisor to the Climate Vulnerable Forum and its V20 group of finance ministers, or CVF V20. We represent nations most vulnerable to climate change, with 1.75 billion people in total population, residing in countries from Africa, Asia, the Caribbean, Latin America, and the Pacific. Individually, these countries are tiny and negligible as separate political entities. But when they work together, they are ants capable of moving elephants. This is what the governments of CVF V20 have done together for several times since its founding in 2009, when it was just 11 countries. In 2015, CVF V20, under the Philippine presidency, was responsible for enshrining the goal of 1.5 degrees Celsius as a temperature threshold, a safe temperature threshold for the planet within the Paris Agreement. Today, CVF V20 has 70 country members, including still the Philippines, which chaired association from 2014 to 2016. It was during this time when I served as the senior advisor to the Philippine presidency of CVF and V20. This period was also when the V20 group of finance ministers was established by the CVF in October 2015, 2 months before Paris, established in Lima, Peru. The purpose of the V20 then is the same as it is now: to translate global political decisions and outcomes into the real economy. In short, we need investments, particularly in infrastructure and low carbon resilience across the economy in response to climate change. A bit of warning, first of all. Speaking as someone who has worked on climate policy for close to 3 decades, climate change is bigger than any emergency the world has ever faced. And yet, it is not necessarily the most important issue for us, for everyone. Why? For a working Filipino family, the priority comes in the form of shelter, health, education, livelihood, food on the table, job security. We must recognize the way climate change has become the biggest excuse as well of official and corporate negligence. In the aftermath of a deluge, or in the face of hunger, failed harvests, failed agriculture projects, climate change has often become a convenient excuse to cover up incompetence. Para mapagtakpan ang kapalpakan, madalas climate change ang sinisisi. Kulang na lang sabihin na climate change ang ikinamatay ni Jose Rizal. Many people continue as well to make the mistake of equating climate change with environmental problems. Certainly, issues related to the environment are part of the climate crisis, but the environment is only a subset of a far larger emergency. A lot of people also mistakenly assume that climate change is all about disasters. Wrong. Again, disasters are but a subset of the climate crisis, perhaps representing in extreme weather events just half of the dangers faced by the world, in particular countries like the Philippines. The other half of the crisis might pose even greater danger to us, but this other half we neglect in the form of slow onset climate events that take place without the drama of calamities and body bags. Sea levels rising in millimeters every year, for example. Irrigation and drinking water steadily, slowly contaminated by salt water. Bleaching coral reefs, acidifying oceans, the steady spread of vector-borne diseases like malaria and dengue. Less rainfall here, more rainfall there. Over the years, this often means sustained crop failures that bring the economies of provinces and communities to their knees. And yet these impacts don't grab headlines, and they take place without media attention because there are no immediate mass deaths. But they impact tremendous pain, inflict tremendous pain in terms of destroyed lives and livelihoods. The climate crisis is not only about super typhoons. Climate change is a fundamentally development-driven crisis. It is a development crisis, and it is a reflection of a crisis of democracy, because a tiny few have and continue to consume the vast portion of the world's resources, the impacts of which harm those least responsible for a warming world. The solutions to climate change therefore require dramatic, strategic, and sustained interventions that are development-driven and must as well be anchored on democracy. In other words, by prioritizing the needs of working families who represent the majority of the world's population, we are able to address the problems of climate change faster and more effectively. It is absurd to say climate change is the great equalizer. No. When severe flooding takes place, rich families cry because their car became waterlogged, tinangay ang supa, at namantsahan ng kortina. But for the poor, they suffer deaths, the loss of limbs, the loss of shelter and health, and the small possessions they have that are often lost irredeemably. Hindi pantay. Constructing evacuation centers throughout the country is also a stupid move, just as deploying thousands of electric cars is short-sighted and ignorant. We live in an archipelago, the geography of which means different interventions are required in very specific conditions, because climate change impacts differ wildly across regions and sectors. Transport is actually a good illustration of how to get things wrong. Let me explain briefly. Prioritizing the deployment of electric cars, for example, as a priority measure in the country's response to climate change is myopic and silly. To begin with, it has been estimated that 88% of Filipino families in the country do not own their own cars. I repeat, 88% do not own their own cars. This means for so many decades, government has been building transport and public infrastructure for the tiny 12% minority population of the country. Even if you replace all currently operating internal combustion engine-powered cars in the Philippines today with modern emission-free electric cars, you would only be addressing the needs and the reality of 12% of the Filipino population. Not good at all. In other words, the more we pay attention to what the majority of the Filipino people need, the more effective our response to climate change can be. And the greater, as well, our country's contribution to the global fight to avoid irreversible climate change harm. Another example, we need to move people, not cars. And this requires the immediate prioritization of mass public transport and the prioritization of the rights of pedestrians and the rights of commuters, which means the prioritization of sidewalks and bicycle lanes and multimodal transport, where a person is able to cycle or walk to work, and they can bring their bicycle onto a bus or a ferry and cycle the rest of the way to their place of work and back to their home. The outcome of using more public transport, whether this is active mobility or mass transport, the outcome is to get to people to travel from work and back to their home in predictable timelines, which only means healthier Filipinos, healthier and happier families, more savings for households, and yes, as a co-benefit, only as a byproduct, far lower greenhouse gases emitted. In other words, instead of chasing emissions reductions, we should prioritize the mobility needs of working Filipino families and also the right of the elderly and children, pregnant women, and persons with disabilities. Because in the end, the fate of the most marginalized and the fate of the most vulnerable will be the fate of everyone. If their fate worsens, so will ours. But if the mobility needs, for instance, of PWDs and the elderly improve in terms of safety and efficiency, you can be sure everyone's condition will improve as well. Resilience is a curious thing. Some have even demanded people to stop romanticizing resilience. Oh no. My goodness, how can you romanticize something that we have so little of? We are not more resilient today. We have become more vulnerable because we are prioritizing and chasing the wrong approaches. The pandemic actually exposed structural weaknesses that would have otherwise taken decades to reveal. COVID was not a black swan event, and so many institutions and experts have actually long warned us that such a horrible event was coming. And today more are projected to come as well. And yet no one had the means to deal with the pandemic when it finally arrived. Why? Because governments thought growing GDP and realizing higher productivity was both the ultimate goal and the means to address an uncertain future. They thought that greater wealth would protect and make flourish both national and local and also household economies. They were wrong. No country was prepared for the non-financial external shock that the pandemic imposed on everyone. None, not even ours. The lesson from the pandemic, unfortunately, has yet to be learned. That productivity and GDP do not equate to progress and healthy, safe, and happy lives in the long term. It's high time that we establish resilience at the heart of macroeconomic fundamentals, at the heart of businesses and communities, in ways where we can measure resilience actually increasing, spreading, and improving people's daily lives. We must bake in climate change in planning across all sectors of society. And certainly, we should look at long time horizons to ensure that we can do more than survive this crisis. We must thrive as well. Thrive despite the threatening realities imposed by climate change. Instead of focusing on emissions reductions, we should bake in resilience. Aggressively pursuing resilience is actually a critical strategy to confronting climate change and also contributing to global decarbonization solutions. The logic is so simple, it will surprise you. See, making everything more resilient, by making everything more resilient, we end up pump priming the economy. Why? Because to make everything more resilient, we must upgrade everything, as in everything. Upgrade infrastructure, hospitals, bridges, ports, energy infrastructure, the power grid, food supply, urban services, logistics, supply chains, everything. We cannot build resilient bridges and ports as well if we continue to be plagued by corruption. And by upgrading everything, we will generate more jobs because we will use more public funds for long-run outcomes and services the public direly deserve. And this provides as well a signal to the private sector because it tells businesses where they should go based on government's priorities. By prioritizing the interests as well of micro, small, and medium-sized enterprises, we protect the majority of working people and the bulk of the economy as well. Because MSMEs, on average, account for 29% of GDP and 78% of the workforce in vulnerable economies. Our numbers actually are higher. And the MSME sector desperately needs adequate insurance protection and the investment capacity to absorb financial shocks as well as to de-risk their own low-carbon transition. Of course, shifting as fast as possible to renewable energy-powered economies, a modernized grid, and active, inclusive mobility-oriented public transport systems will produce healthier lives and less air and water pollution, and certainly less carbon emissions. But these will be outcomes of interventions that must prioritize the development needs and aspirations of the majority. If we want more resilience and more effective measures to make programs and public infrastructure more resilient, we must pay far greater attention to public health experts. We must listen to mobility advocates. We must focus on the mountains of research outcomes that show dependency on coal and fossil gas will continue to deprive our economy of the energy security our country desperately needs. And it only will move us farther away from the transformed modern economy propelled by decentralized clean power produced where it is consumed that our people have long deserved. If we continue this, we will only throw out more and more scarce resources in order to continue to import fossil fuels that pose an existential threat to our people and the very viability of the Philippine economy. The logic is quite clear. Make resilience the topmost priority of the country and develop ways we can measure and verify improvements in resilience. Our people will be better for it. Use everything in the toolbox because everyone counts and everything matters. It's not too late, but we have less and less time left to act, and we must act with leadership and a far greater sense of solidarity and purpose. That's it. Maraming salamat po. And thank you again for inviting me.
I bet we have not heard of all of these climate-related concepts, the relevant concepts to climate change presented that way. Okay. Do you agree? Okay. Certainly an eye-opener for me and something for us to think over well after this concluding lecture. Okay. Some of the key phrases that we take home from Mr. Constantino's lecture are integration of strategies, sustainable resilience, pathfinding, communities for climate action, workplaces for climate action, climate change as the greatest emergency, dramatic, strategic, and sustained interventions, and prioritizing the needs of populations. He admonished us that climate change is bigger than any emergency the world has faced, and yet not the most important issue, apparently. Not as important, certainly, as the issues of the daily lives of our people, such as providing shelter, food security, and others. Okay? So we heard him say that certainly situations of the environment may be climate related, but the causes may be very much identifiable, local, and certainly addressable. So communities and workplaces may be facing these development-driven crises that altogether cause harm more immediately, but ultimately contributes to the climate crisis. So if we take care of Filipinos and their daily needs, by extension, we will also address climate issues. We become climate action advocates. It is not just resilience we are after, but in improving the daily lives of our people, we will thrive for longer despite the threats that we are facing. How about you? What are your own take-home ideas from the concluding lecture? Please feel free to add your own take-home phrases in our Zoom chat. Not only from this lecture, but from all the other sessions that we have heard from for the past 2 days. To all of you in our meeting room, we have noted your questions and also your remarks all throughout this concluding lecture. Our organizing committee will strive to bridge these questions and remarks to Mr. Constantino offline. We will also take your compliments to Mr. Constantino on his sharp concluding lecture. We extend our heartfelt gratitude to him for contributing to the 7th EOH Forum, and we are honored to present this certificate of appreciation. Please allow me to read the citation. The College of Public Health, UP Manila, Semiotrope Philippines Regional Center for Public Health, Hospital Administration, and Environmental and Occupational Health awards this certificate of appreciation to Mr. Renato Redentor Constantino for their invaluable contribution by sharing their expertise as a resource person during the 7th EOH Forum with their talk entitled Integrating Strategies for Sustainable Climate Resilience, a Path Forward for Communities and Workplaces, that's conducted by the Department of Environmental and Occupational Health, done remotely from the College of Public Health, UP Manila, on 22nd November 2024, given on this day in the city of Manila, Philippines, and signed by former Dean Professor Romeo R. Quezon, overall chair of the 7th EOH Forum, Dr. Crystal Emil Estrada, department chairperson, Associate Dean for Research Sharon Yvette Angelina Villanueva, and the College of Public Health Dean and Center Director Fernando B. Garcia. Thank you again, sir. Should you tune into this recording, our compliments and thanks to you. Okay. I now hand over the virtual floor to our strong moderator because she has been capturing the floor after every session and has likely built muscles by this time. Thank you, everyone. This has been Gaylene Manalang Jr., your moderator. Prof. Duarte, let us proceed to the next part of the program.
Thank you very much, Professor Manalang, for that excellent facilitation of the earlier session. And thank you also to Mr. Constantino. So truly all of our lectures have been insightful and eye-opening. So should any of our participants or attendees wish to rewatch any of the 7th EOH Forum lectures or sessions, you may do so through the DEOH official YouTube channel, whose link is also found in the EOH Forum Google site. And now, to officially bring today's event to a close, it is my great pleasure to invite Dr. Crystal Amiel M. Estrada, Chair of the Department of Environmental and Occupational Health, to deliver the closing remarks. Dr. Estrada has been a significant support behind the success of this event, guiding its vision and ensuring that our discussions were relevant and impactful. Her expertise in environmental and occupational health has helped shape the themes and direction of today's sessions, making them both insightful and action-oriented. We are honored to have her close this year's forum. Please join me in welcoming Dr. Crystal Amiel M. Estrada.
Thank you very much, Professor Duarte, and good afternoon again to everyone who has joined us for the past 2 days of the 7th Environmental and Occupational Health Forum. So as we close this year's forum with the theme Resilient Futures, Enhancing Health and Safety in Communities and Workplaces Amid Climate Changes, allow me to express my heartfelt gratitude to all our speakers, panelists, partners, and participants, especially for your sharp and valuable insights and contributions. I would also like to thank the leadership of the University of the Philippines, Manila, through our Chancellor, Dr. Michael P., and the College of Public Health, through our Dean, Dr. Fernando B. Garcia Jr., for their support to our department's activities. I'm also particularly grateful to our efficient organizing committee led by Professor and former Dean Romeo Quezon, for this forum would not have been run as smooth and glitch-free without your leadership, and of course the help of our very able department faculty and staff working behind the scenes to ensure that you, our dear participants, get the best learning experience for this past 2 days. Today, and hearing from all our speakers from yesterday and today, we have reaffirmed that climate change is not just an environmental issue. It is a health emergency, if not the greatest emergency that we are facing today. The greatest impacts of climate change will be felt by our vulnerable populations, the young, the elderly, the working poor, those working in the informal economy, and our workers in micro and small enterprises. The Philippines, as one of the countries most at risk from disasters, faces the dual challenge of managing our climate risks while ensuring the health and safety of our communities. We recognize that climate resilient policies and frameworks are vital in guiding actionable and sustainable interventions in our country. And this is crucial to safeguarding the well-being of our people, especially our vulnerable communities and the health of our planet. However, after hearing also from our lecturers for the past 2 days, we recognize that this cannot be achieved in silos. Collaboration across different sectors is the answer that we need for meaningful action to take place, whether in workplaces, communities, hospitals, or the broader public health sphere. It is only through working together across these different sectors and disciplines, using innovative technologies and strategies, it is only then that we can truly build a truly resilient future. As we move forward, let us be inspired by the collective resolve and expertise presented by our esteemed speakers for the past 2 days. May we continue to champion resilience, sustainability, and health in the face of climate change, ensuring a safer and healthier future for our future generations. Thank you again, and let us keep moving forward together toward a resilient and sustainable tomorrow. Thank you, everyone, for joining us in our 7th Environmental and Occupational Health Forum, and we look forward to seeing you in our future events. Over to you po, Professor Duarte.
Thank you very much, Dr. Estrada, for the warm closing message. And now, as we close the 7th EOH Forum, we sincerely thank all of our participants for joining us and for contributing to today's success. We value the time and the effort that you've dedicated to this event, and we look forward to having you in our future events, all towards working together to create healthier communities and workplaces. Before we end, may we request you to take a moment to complete the evaluation forms. Your feedback is vital in helping us improve the quality of our future events, and we truly appreciate your input. It allows us to better cater to your needs and expectations in the future. So while we are receiving messages of thanks in the Zoom chat box, we'd also appreciate you accomplishing the evaluation forms for our documentation. We are also excited to announce that we'll be gathering again next year for the 8th Environmental and Occupational Health Forum on November 20 and 21, 2025, and we look forward to seeing you all there. We'd also like to invite you to join us in the next postgraduate course in occupational health and safety on February 17 to 21 and 24 to 28, 2025. We'd like to request you to visit our Facebook page, DEOH UP Manila, or the Google site that we shared with you earlier for details and registration. We're also pleased to announce that the certification course for water refilling station and plant operators will be held on January 13 to 17 and 20 to 24, 2025. Now, at this moment, we invite everyone to join us in the singing of UP Naming Mahal, the beloved hymn of the University of the Philippines. Its message of unity, pride, and commitment to excellence transcends all boundaries. Thank you once again for participating in this forum, and we look forward to reconnecting with you in the future. We hope to see you all next year. Thank you, everyone. Have a nice day ahead.
Thank you.
Thank you po to all our speakers and guests.